Good afternoon, everybody. We'll be starting shortly, just making sure we iron out everything on this end. But we'll be starting shortly. Thank you for being here. I recognize some folks have hard stops, and so no worries, we'll be underway shortly.
Councilor Arroyo, can you hear me?
Yes.
Okay, it'll just be one moment. I was unable to hear you. I missed what you just said. Were you speaking to me or just speaking to everyone in the meeting?
No, just telling everybody that we were going to be running in a couple minutes as soon as we get all the technical stuff ironed out.
All right, perfect. I'll be with you in just one moment.
Thank you.
You're welcome.
Just give me a heads up when we're ready.
Okay, perfect.
And I'm here, Councilor Arroyo.
I see you.
Good to see you.
Good to see you too.
Good morning, Ricardo.
Good afternoon, Councilor Flynn.
Good afternoon.
Councilor Arroyo, we are all good to go.
Wonderful. So we're going to go ahead and start on that note. For the record, my name is Ricardo Arroyo. I'm the Boston City Councilor for District 5. I'm the chair of the Boston City Council Committee on Public Health. I am joined today by my colleagues, Councilor Ed Flynn, Councilor Andrea Campbell, Councilor Michael Flaherty, Councilor Michelle Wu, and Councilor Kenzie Bach. And as other councilors appear, I'll make sure to note that they've arrived. This public hearing is being recorded and live streamed at boston.gov City Council TV. It will be rebroadcast on Xfinity Channel 8, RCN Channel 82, Verizon Fios Channel 964. We will take public testimony at the end of this hearing. If you wish to testify via video conference, please email Shane Pack, that's SHANE.PAC at boston.gov to sign up. When you are called, please state your name and affiliation residence and limit your comments to no more than 2 minutes to ensure that all folks providing public comment can be heard. You may also submit written testimony by emailing ccc.health@boston.gov. Today's hearing is on docket 0142, which is an order for a hearing regarding COVID-19 vaccines by Councilor Campbell. And just so folks know who are here on the panels, in order to keep this running smoothly, we've separated folks. And the order for today's presentation will be the medical community, part 1, as we're calling it, which would be Manny Lopes, the East Boston Neighborhood Health Center, Wanda McLean from Brigham and Women's Hospital, Sandra Cotterell from Codman Square Health Center, followed by Marty Martinez, Chief of Health and Human Services, Rita Nieves, the Interim Executive Director at the Boston Public Health Center, Boston Public Health Commission, Dr. Jennifer Lowe, Medical Director for BPHC, followed by Dr. Thea James at the BMC, Dr. Robin Reisberg at Boston Community Pediatrics, Dr. Paulette Denise Chandler, the doctor at Brigham and Women's Hospital, Dr. Andrew Marshall, and Dr. Otugo, Mass Coalition for Health Equity. And then we'll go to what we have for public testimony, followed by community leaders, Diane Wilkerson from the Black Boston COVID-19 Coalition, Shalini Pamal, Doctors for America, Josiane Martinez, founder and CEO of Archipelago Strategies Group, Claire Lewis Okalani, COO of African Community Economic Development of New England, and James Morden, the president and CEO of the YMCA. And with that, I'd like to turn it over to the sponsor, the lead sponsor on this, Councilor Andrea Campbell.
Thank you, Councilor Arroyo, and thank you for the partnership as well, and thank you for your leadership of this committee. I also want to thank my council colleagues for being in attendance on this critical issue. And of course, want to thank each and every one of the panelists who I know are extremely busy as we continue to fight, obviously, COVID-19. So for you guys to take time out of your schedules, I'm extremely grateful, particularly with respect to this conversation. And will do my best working in partnership with Councilor Royal to make sure that we do move this along so we hear from you and don't have you on this hearing for 4 or 5 hours. So thank you very much. I first filed this hearing order back in December, knowing that equity in the vaccine distribution process would be absolutely essential to our COVID recovery as a city. But as of right now, we know that we still have a lot more to do to ensure equity and access to the vaccine. The latest report shows that residents, white residents in Massachusetts have gotten nearly 36% of the vaccinations. Under 20% have gone to those who identify as multiracial, 3.3% to Hispanics or those in the Latinx and Latino community, 2.8% for Asians, and 2.6% for Black residents. And we've all seen the data, and I think we all are finding it to be a bit disturbing. And I'm also hearing from our seniors, of course, a lot of them that they too are having trouble getting an appointment, gaining access to transportation and other things they need in order to be able to not only make an appointment, but also to attend an appointment to actually get the vaccine. And as we think about how we recover from COVID-19, it is critically important that the city, of course, take the lead on developing a multilingual, culturally competent strategy to ensure that every single person in the city of Boston is vaccinated, especially those communities that are hardest to reach, including our immigrant communities, our Black and Brown communities, and those who are also undocumented. In order for us to recover from COVID, everyone must take part in this vaccination process. And having a vaccination site in every neighborhood does not equal equity in terms of access to the vaccine. We know it has to be a multifaceted plan that requires all of us to play a role, all hands on deck. One, to make sure we are getting out the information that people need to answer their questions for themselves and their families about the vaccine, making sure that we are doing away or responding to the fears in communities of color, especially Black and Brown communities, with respect to getting the vaccine based on the history of distrust between the medical community and those in communities of color. And in addition to delivering information, we have to make it easier for folks to contact someone, to ask questions and get their questions answered with respect to their questions regarding the vaccine. And then, of course, reducing the barrier, whether it's transportation, accessibility issues, or other things that may keep them from actually getting a vaccine in person. And so looking forward to hearing updates from the city as to where we are, and of course wanted this to be public so folks in the community could participate, but also looking forward to hearing from all of our panelists on what is working, what is not, and how we as a city can do better to make sure that this vaccine rollout is indeed equitable. So thank you again, Councilor Royal, for scheduling this in a timely manner. Thank you again to all of the panelists who are part of the conversation today to make sure that we are indeed reaching every single resident in the city of Boston and getting them everything they need in order to access a vaccine so that they can keep themselves and their family, and of course our community, safe and healthy as we then look forward to economic recovery, education, return, et cetera. So thank you again, and thank you, Councilor Royal.
Thank you, Councilor Campbell. And we're going to be foregoing openings in the interest of time. I'm going to ask that panelists keep to 5 minutes max, and that councilors as well keep to 5 minutes max. I've generally allowed councilors to go over that 5 minutes, but because we have so many panelists and because we have so many time restrictions, I'm not going to do that now. And just for folks who are watching this and trying to get a grasp on what the goals are here, for me, I see the goals twofold. I think from a operational standpoint, we want to know what the plans are to make sure that these vaccines are reaching folks who want them, what we're doing to ensure that we're providing equity, both racially and by age, and all of the different ways in which we do these factors. I think it's really important to know that we're dealing with issues, for instance, like life expectancies and all of the different ways in which racism as a public health crisis has impacted whether or not the average age, for instance, in Roxbury is 75. It's not. And so when we're talking about life expectancy and how we get these vaccines into our communities, we need to address that operationally. But I think there's also a second question here and a second goal, which is education, making sure people understand what these vaccinations are, what they do, and how they operate, and understanding that distrust from certain communities, which I've been calling folks myself in our communities to ensure that we're signing them up, isn't just some illogical fear. It's based on a history of experimentation that has occurred on Black and Latino residents and civilians in this country. And I think we have to really face that and be honest about that. Otherwise, the way I've talked about this is you don't tell somebody who's afraid of heights that's foolish, come down from there, right? Like that's not how that works. You have to actually meet them where they are and talk to them in a real way. And I'm hoping this conversation will both educate both on the operational side and also what the vaccine does and why it is safe to take it. And in fact, why we should all be taking this vaccine. And with that, I'm going to go ahead and go over to our first panel. And that will be Manny Lopes from the East Boston Neighborhood Health Center, Wanda McLean from Brigham and Women's Hospital, and Sandra Correll from the Codman Square Health Center. And if you just keep your openings to 5 minutes, and then we can go to the council for questions. And I'd ask that we keep that to 5 minutes so that we can move through this as quickly as possible. They'll be followed by the administration. So that's Marty Martinez, Rita Nieves, and Dr. Jennifer Lowe following that panel. So with that, I'm going to go right to Manny Lopes.
I don't think we can hear him, Councilor Arroyo.
Yeah, I'm not sure if you're muted or if your speaker's off. Oh, hold on. Actually, here's what we're going to do. Let's do the administration in this panel first. So with that, let's actually start with Marty Martinez, Chief of Health and Human Services.
Sure. Good afternoon. Can you hear me, Councilor?
Yes. You're a little in and out. If you can, I don't know if it's a volume issue.
Great. Hopefully you can hear me. So thank you, Councilor Arroyo, and thank you, Councilor Campbell, for following this order, as well as I see Councilor Sabi George, Councilor Wu, Councilor Bach, Councilor Braden, and Councilor Flynn. Thank you all for being here and allowing us to share. So we have a slide deck, and obviously classic us, it's more than 5 minutes, but we will keep it short and just highlight 2 slides for you. I'm joined by Dr. Jennifer Lowe, who is our medical director for the Boston Public Health Commission, to answer questions that folks may have. So if we could pull up the slides, I think the central staff has the slides for us. We could pull those up. Great. So we'll just go, we're going to go to the Massachusetts slide first, briefly. I just want to remind everybody that there in the Massachusetts Vaccine Strategy Overview, the state, per federal parameters, the Commonwealth manages vaccine distribution efforts, including the prioritization of population, phases of eligibility, distribution of doses to clinical providers, and all the tracking related to vaccine distribution. I'm lifting that up here for this conversation because the critical role the city plays, I just want to make sure folks clearly understand that the state sort of, per the federal parameters, controls virtually who gets the vaccine to be able to administer it, and ultimately whose arm it can go into and when. And so that this city's working within that construct to support their overall strategy. Next slide. We'll show you that here is the current prioritization. I think people are familiar with. It's a phased prioritization. Phase 1, which is still open, obviously, was available from December into this month. Phase 2, which we are in the beginning of that phase, which is individuals 75 and older, is currently what's available and eligible. The rest of those phases we will walk through or get through the state prioritization. And then phase 3, which is the general public, looks to be available as of April. The state has laid out this guidance to hospitals, health centers, clinical providers, local boards of health, and others to be clear that this is who is to be vaccinated in the order that is laid out across these priority groups. Next slide. The City of Boston strategy and obviously is to ensure that there's equitable access to the vaccine across all populations and neighborhoods in the city. We're working hard to ensure that distribution efforts include accessibilities in communities and neighborhoods hardest hit by the pandemic. And that's important to remember, that's by age, race and ethnicity, and geography. And it's important to think about that. And so we've been really focused on ensuring that within the context of the role that we play, that we can focus on those pieces. We want to make sure there's access also to data specific to Boston. I heard Councilor Campbell review the data that was shared by the state. That data obviously needs to be improved. We don't have Boston city specific data yet. We believe we will have that early next week. That will give us a sense of residents living in the city by where zip codes, hopefully, in terms of the percentage of folks being vaccinated in the city. Again, state controls the access to that data, and we will continue to advocate with them and partner with them to have it. Along with that equitable distribution efforts, we're focused on building widespread public awareness of the benefits and the importance of the vaccine, and we'll touch on that briefly. And then finally, we're working to match vaccine availability with distribution efforts to meet the needs of our residents, to make sure that we can meet the neighborhoods and residents where they're at with vaccine. So let me briefly show you the four-pronged approach. I know some of our counselors have seen this, and I want to make sure our panels know this, but also that the public does. The city is working through a four-pronged approach. One is mass vaccination clinics, and those are the clinics everyone sees in the media right now. Currently in Boston, we're talking about Fenway Park and the Reggie Lewis Center being established as large clinics. These are clinics that ultimately will be able to do more than 1,000 individuals per day. Right now in Boston, the two sites are able to do about 750 a day together. As they ramp up, the goal would be by the end of the month or the beginning of next month to be at close to 3,000 a day between the two sites. Again, this is about large numbers of throughput, getting lots of people vaccinated in large sites. The second model for us is priority group clinics. Priority group clinics are smaller sized or medium sized clinics that are currently vaccinating folks that are eligible in priority groups. These have been going on longer than the mass vaccination sites. They're just not big public clinics. These are clinics that are running to vaccinate certain individuals based on who is eligible. So as of early January, through the federal pharmacy program, roughly 70 different senior buildings have either been visited or are scheduled to be visited for clinics on site. And we continue to work with that pharmacy program to ensure that those visits happen and that the buildings that do not qualify, including our BHA senior housing and other buildings, can get access to a clinical partner to help them get vaccinated. In addition, Tufts Medical Center, BMC, a variety of community health centers have also been using priority group clinics to vaccinate individuals. It's how we in the city have vaccinated our first responders. It's how we vaccinated our school nurses. It's how we vaccinated a variety of other folks through priority group clinics, which are not the big public clinics, but are designated for the intentional use for partners. As of this week, hospitals and health centers have opened clinics to vaccinate their own patients in Dorchester, East Boston, and Brighton, including on their own physical locations. And by February 22nd, BPHC will open up additional clinics to vaccinate essential workers, including K through 12 educators when they become eligible. The third model, which has not begun yet, is the community-based public clinics for the most part. These are clinics that are meant to be clinics specifically for the community. They're not specific to patients or specific to priority groups, but they're open clinics in different neighborhoods. You'll see through the details that are there by the second to third week in March, we hope to have 20 completely open clinics where there are no other restrictions other than who's eligible. BPH is working to secure at least 10 of those in collaboration with a clinical partner and a CBO by February the 22nd. It's really important to note that we want to keep these clinics in diverse neighborhoods. We want to make sure there's access across the board, but these are all based on whether or not there's the availability of doses. I see many of our healthcare leaders on this panel. They will tell you that dose availability is going to determine whether or not you can, how many of these clinics you can have, how many people you can vaccinate at a time, and again, working through that with the state. So we'll continue to talk through that a little bit. The other thing I'll mention on the community-based public clinics. This is also where pharmacies fit in. Currently in the city of Boston, there's 5 pharmacies that are accessible for appointments for those who qualify. I think that number will be close to 9 as of Monday, and more pharmacies will come online as more availability of doses becomes available. And then the last model for us is mobile vaccination teams, bringing clinics to organizations, to entities, to community groups for one-day clinics. In collaboration with Boston EMS, BFD, and other community partners, we seek to create mobile vaccination teams that can bring clinic access to community organizations, to faith-based organizations, where we may not be able to get a community-based clinic to run for a month, but we may be able to set up a day here, a day there, to be able to create greater access across the board. So over this 4-pronged approach, this mass clinics, the priority group clinics, the community-based clinics, and the mobile vaccination teams, our goal is to ensure that we can create access where it needs to be across the community. One last slide, and it's I'm going to skip this next slide because we can answer questions, but 2 more slides here. I think I'm going to make sure that I know there's a lot of folks on this panel right here. Our approach to equitable vaccine distribution. So our approach focuses on having sites in diverse communities that are inequitably impacted by race, ethnicity, by neighborhood, by age, and including set-aside slots at targeted locations. We know that access isn't just about putting a clinic in a community, but we have to set aside slots, and we can talk more about how we've done that. We're partnering with trusted community-based partners to meet residents where they are in locations like houses of worship and community-based organizations, as we're currently planning community clinics and mobile clinic efforts. There is not enough doses currently available to set up community clinics all over the city, but it doesn't mean that we're not actively working right now with partners to be able to line those up with clinical partners to make them accessible when we have enough doses available. We're working to ensure there's cultural and linguistic competency in the operational components of all sites running. So not just those sites that are being managed currently by us or by partners, but making sure that there's language capacity, that there's cultural competency at sites and locations, which include, if you're serving 75 and older, do you have places for people to sit? Do you have places for folks to use the restroom? Do you have access to wheelchairs? Do you have access to where caregivers can go? All those things that come into mind when you're trying to make sure a site is as accessible as possible for the populations you're trying to reach. There's a focus on non-location specific efforts to prevent widespread access, including barriers like transportation, time from work, ease of appointment, and no proof of residency or identity required. I want to stress that one of the balances we've heard a lot is about locations that are only available to a certain group of people based on where they live. But one of the challenges around that is we're trying not to force folks to prove their residency or or to show a government issued identification, so we don't have a barrier for folks accessing sites. So again, we're focused on non-location specific efforts as well around our equitable plan. And then the last tool I'll share with you is we're advocating for an equitable distribution of doses in communities hardest hit, to ensure those hardest hit neighborhoods have access to the vaccine, which includes a higher allocation to communities of color. Again, the city does not control where doses go and how many doses an organization or health center gets, but we can continue enjoying the advocacy to ensure that our neighborhoods that are hardest hit are getting the vaccines necessary, which is what we've done with some of our community health centers already. And last but not least, and definitely pointed out to Councilor Arroyo's point, we need to build public awareness efforts to build confidence in the vaccine, and that's key to supporting widespread access in communities of color. There's basically 2 lanes that we think about it in the city. One is knowledge is power, giving folks information and accurate information about the safety of the vaccines, how they were tested, what the trials looked like, sort of the medical side of that conversation, which is key, so folks can make healthy decisions for themselves and their families. And then the other lane is personal stories to connect folks. Dr. James, who's on this panel as well, shared her personal story herself about how she decided to get vaccinated and what went into that decision. And we think those personal stories relating from leaders in communities of color and healthcare leaders in our community help to make sure we're breaking down some of the challenges that exist around this overall goal to ensure that we're building confidence in the vaccine. So there are many other slides in here. We have more information to share, but I want to be conscious of the time that there's a lot of folks in this panel. And Dr. Lowe and I are here to talk more about the overall equitable distribution strategy and what we're doing to not only follow the state's leadership, which we need to do, but also partner with the healthcare leaders and partners that are on this call to make sure we're creating the access necessary. So with that, I'll pass it back to you, Councilor Arroyo.
Thank you very much. And I don't know if I already did it, if I already announced them, my apologies, but Councilor Mejia, Councilor Savi George, and Councilor Braden have also joined us and have been here for the duration of the panels. Dr. Lowe, if you're able to go next, and if we can try to keep it to 5 minutes just to make sure that there's time for questions for the first group.
Hi, thank you so much for having me on this panel this afternoon. I just wanted to present a little bit more information about vaccine safety so that you can share with your constituents. There's been a lot of concern about vaccine hesitancy as related to the safety of the vaccines. I just wanted to reiterate that the U.S. vaccine safety system ensures that all vaccines are as safe as possible and that COVID-19 vaccines are being held to the same safety standard as all vaccines. Vaccines go through more testing than any other pharmaceuticals that are on the market. And of the 70,000 people more than 70,000 people participated in the COVID-19 vaccine clinical trials. In the Moderna vaccine trial, 20% identified as Hispanic or Latinx, and 9.7% identified as African American. Of those who participated in the Pfizer vaccine trial, 26.2% identified as Hispanic or Latinx, and 9.8% identified as African American. After these trials, multiple independent groups review the safety of the vaccines to determine if the vaccines themselves the safety of the vaccines and the potential benefit of the vaccines outweigh the known and potential harms of being infected by COVID-19. So based on that, the vaccines are approved by the FDA and CDC. There has been a lot of concern about the rapidity at which the COVID-19 vaccines have been developed. And so I just wanted to make a few comments on how people can be reassured that safety was not sacrificed in the rapid development. So first of all, researchers, when developing the vaccines, researchers used existing clinical trial networks like the ones they used for HIV study treatments and vaccines to begin quickly conducting COVID-19 vaccine trials. So the time it takes to develop those networks did not have to come into play. Another critical piece was that investment in manufacturing started before the vaccines were proven effective. Under normal circumstances, investment in manufacturing doesn't occur until the the trials have gone through and the trials are completed and approved by the FDA. In COVID-19 vaccine development, the government and manufacturers worked simultaneously to test and develop the vaccine at the same time. And finally, just given the unprecedented public health emergency, both the FDA and the CDC prioritize the review, approval, and recommendation of COVID-19 vaccines. So this is all to say that I think a lot of the concerns around safety and the rapid development of the vaccines, there are reasons for it. And so it's our role to really present this information to our constituents so that they understand that safety is still a primary concern. If they choose to get the vaccine, which we want them to do, that they can be reassured that it is safe to do so.
Thank you very much for that. I'm now going to go to Manny Lopes.
Thank you, Chair Arroyo. Can you hear me okay?
Yep, perfect. Audio is perfect.
All right, great. Thank you. Thank you again for inviting me into this discussion, and hello to my fellow panelists who are working very closely on this crisis. My name is Manny Lopes, and I'm the president and CEO of East Boston Neighborhood Health Center. We have locations in East Boston, South End, as well as some in the surrounding communities, Winthrop and Revere. We serve over 120,000 patients, which makes us one of the largest community health centers in the country. And we have been hard at work since the beginning of this pandemic. I think last time I visited, we talked a lot about the testing efforts that we've done, and that will continue as we now begin to ramp up on the vaccines. And a lot of this work is being done in partnership with the Boston Public Health Commission. And I should also note that I am the chair of the Boston Public Health Commission, and it's great to see my fellow Boston Public Health Commission experts on the panel as well. First on staffing, happy to report that at this point we've vaccinated over 75% of our staff here at the Health Center. These are the frontline workers that qualified under the phase 1 state guidelines, as Chief Martinez has reported. We've learned a lot in vaccinating this group. 50% of our staff come from the communities we serve. So these are people who represent and have some of the hesitancies that we are talking about today. And they've actually informed a lot of the work moving forward. As you may have heard last week, we opened up 4 sites in 2 days, East Boston, South End, Revere, and Chelsea. And we built up capacity right now to do 4,000 vaccines a week. Our hope is that that will continue to get ramped up to anywhere to between 6,000 and 7,000 a week. And as many of you already know, that East Boston in particular, along with Chelsea, have been one of the hardest hit communities in the state. As it relates to vaccine hesitancy, and I'll pause after this for questions, you know, we're looking at this as not a one size fits all. As you know, when we open up these public sites, we know in East Boston and Chelsea, we're serving a large Latino population, Latinx population. And there's not only mistrust of the healthcare system, but there's also mistrust in government, and particularly as it relates to those with different immigration status. And as we look in the Black community, as already been mentioned, the mistrust and distrust with medical institutions. And then even when we look within the Moroccan community, which is a large population that we serve as well, there's other concerns there around the vaccines. So again, leveraging our trusted partners in the community, leveraging our staff as ambassadors to get the right information out, leveraging the support from the city as well as the state to help us message this and to build the capacity for us to, again, whether it's supply, staffing, space, or even startup costs to help us do this work. One of the other points I want to just address is, you know, some of these sites may not be as busy as we would like it to be, particularly initially. And from my perspective, I think this is going to be a long journey for us as we really try to reach each and every person, answer their questions that they may have related to the vaccine. But I think what's really important here is for us to be open and available for when that person says yes. And I think that's a really important part, that we open, you know, hopefully 7 days a week, mornings and evenings, because we know this population are the essential workers. They're not working from home. They're working various shifts. And again, when they say yes, we want to be open and available to them. And I'll end there. Thank you.
Thank you so much, Mr. Lopes. Ms. McLean from Brigham and Women's, if you're able to go next.
Thank you so much, Chair Arroyo. I'm Wanda McLean. I'm the Vice President for Community Health and Health Equity at Brigham and Women's Hospital, and I'm pleased to be with you this afternoon. No surprise to anybody who is on this call, but COVID-19 has laid bare the disparities that we have seen historically that have been hidden in plain sight. So I think, you know, if there is any silver lining to this, it's that that we now are all clear that the disproportionate illness and death that we're seeing with this pandemic basically points to, you know, 400 years of disparities in health outcomes for people of color. We're witnessing a legacy of distrust, and we're seeing that in COVID vaccination uptake, and also in our efforts when we were looking to get more people of color in the COVID vaccine trials. And we've been approaching this legacy of distrust with the best intentions in COVID to prioritize those populations that have been disproportionately impacted, and have heard from many of those populations that they don't trust our intentions, and in fact that they fear them. Those who have often been at the end of the line are not inclined to trust us when we say you can go first, and that's unfortunate, but that is what a legacy of distrust has laid on us. And it's not just the historical, and we often talk about the historical reasons for Black mistrust of the healthcare system. Those are true, Tuskegee and Henrietta Lacks and all of those. But it is also how people are treated today by the healthcare system that also impacts their willingness to trust us. And so we're looking in the work that I do and at my hospital at how we can address the barriers that we're seeing from populations and how we can increase vaccination. Mandy Lopes talked about vaccinating employees. We are up to about 64% of our employees being vaccinated, and we are seeing a disparity between our Black and our white employees. And so we have used a lot of strategies to attempt to close that gap. Some of them are, strategies that I think are going to be that are important as we vaccinate patients and as we move to vaccinations in our community. We have question and answer sessions with our employees where we, in a non-judgmental way, listen to every question and attempt to provide the information that they need to have them feel comfortable making an informed decision. We have employees who have been vaccinated and do what we call a My Why campaign, why I got vaccinated. So picture of the employee and the reason that they got vaccinated. One of my favorite ones of those is one of our staff people who said, "I'm a mama's boy and I want to hug my mom." And so, that was his why. And so we use those. And then, as others have said, making sure that we have information in the languages that our employees take their information in. I think COVID has been incredibly important in helping us realize as an institution how important interpreter service, translation service, and having information accessible. We also realized that we have a technology now that we use where everyone who comes in, every employee who comes into the hospital fills out a pass that says that they are symptom free, and then they get the ability to show that pass and come in, and that's using on your smartphone. Well, not every employee uses a smartphone, so we had to have a strategy for those non-smartphone users, and we use that technology. And the importance of vaccination here is that we use that technology to have employees sign up for vaccinations, but again, it would not be equitable if not all employees use that. So when we looked at our patient portal, now that we're vaccinating patients, making sure we know that patient portals are not accessible universally. And so using other strategies to outreach to our patients, phone calls, text messages, and those phone calls coming from practices with phone numbers that they recognize and that they trust. So, we are deploying a lot of strategies, including as we release, as we're eligible to vaccinate patients, weighting those areas that have a disproportionate high number of COVID disease and penetration, putting those neighborhoods first, and also identifying those zip codes where there is high need. And I will just close by saying that, this issue of mistrust within the healthcare system is longstanding, and it will take a lot of concerted effort and time to build that trust. Often we talk about rebuild, but I think we really have to build. And in the meantime, I think we all have to do what we can. And as I said, in a non-judgmental manner, respect the intelligence and concerns of those who are waiting and or who have questions, and tackling those broader issues that we know are important to achieving racial and health equity. This will take us working together. So it's hospitals, it's community health centers, it's public health, it's government, it's all of us working together to make sure that we can equitably distribute vaccines within our community. And I will stop there.
Thank you so much. And I just correct me on the pronunciation of your last name, because names are important. Sandra Cotterell from Common Square Health.
That's it, Cotterell. It's a challenging name, but you did good.
Thank you.
Good afternoon, everyone. I'm Sandra Cotterell. I'm a lifetime Bostonian. I live in Mission Hill, and I'm the CEO of the Common Square Health Center and have been at the health center for over 25 years. Thank you all for the opportunity to speak on the COVID vaccine. And because of time, I'm going to kind of pick up off of some of the comments that my colleagues have made. So the health center is located in Dorchester and has been servicing the community for over 40 years. And when the pandemic hit, just like so many other health centers, we had to really reshape what we were doing to respond to the pandemic. And it initially started with partnering with the Boston Public Health Commission to stand up testing, as Manny said. And we did that initially in a tent in front of our health center, but as the weather became cold, we had to find a new home for that. And so we went to the Russell Reed Auditorium, which is located in Dorchester on Norfolk and Blue Hill, and stood that up as a testing site where we were actively testing people 6 days a week. And that location will become the new home for a community-based vaccination site. So at that location, within the next 2 weeks, we will be partnering with Boston Medical Center as well as other health centers in the Dorchester and Mattapan area to make that site a vaccine site. The concept of distrust and hesitancy runs deep. We have also seen within our workforce, we're probably at about 55% vaccination of our workforce. And clearly around racial lines, you can see the difference and the hesitancy. And a lot of our employees of color are at the low in terms of acceptance. And what I will say is that it is that peer-to-peer, it is the town halls, it's telling them I took it, it's okay, that convinces them. So we've had to do a lot of that, and I feel like we need to do much more in that space. We are taking a multiple prong approach with testing. Patients know the health center, they know us, all the cultural competency issues that have been discussed, we can address that in our model of care. So we will be providing vaccine for people at the health center and offering that as a health center-based clinic. Yesterday, I was pleased to see the number of elders show up on time, as my staff said, ahead of time to get their vaccine, which tells me that if we get the message out and we educate, then we can make a difference. We had about a 90% show rate with our seniors. And as you all know, the weather wasn't that great, so that made me nervous, but they showed up. And we will also look to launch our Dorchester site, but we also have practitioners who recognize we do have people in their homes and in housing, and we are looking to go into those places as well. And so I think it's going to be very important that we look at access and ease of access and availability to fight this, and to do that peer-to-peer education, because even though we're looking at hesitancy, I like to think we're not looking at refusal, and it's going to be our collective voices that can make a difference in terms of getting vaccine in arms. I also want to point out, because there's a lot of discussion around this, is we are also looking at having an aggressive strategy on waste management. We hear about it. And so really making sure that we have wait list of people who may have canceled or may not have shown up at the last minute, and aggressively managing that, because we do not want waste. We want vaccine in arms to combat this. And so that's something that takes a lot of thinking and a lot of strategy, but it's an important effort that also has to be looked at. So it is going to take a village, but I think collectively we have the wisdom, and I think that having local based sites, as Chief Martinez has mentioned, will make a difference in terms of, you know, people coming to a place in their neighborhood that they know, with faces that they're familiar with. I'm hoping that that will start to make a difference in our neighborhoods that have been significantly impacted by this. So with that, I will end my comments, but thank you for the opportunity.
Thank you all so much for being here. I'm now going to go to the counselors, starting with the sponsor and then order of arrival for questions. Please try to stay to 5 minutes. When you see my hand go up like this, that means you've hit 5. It also is the universal signal for stop. So hopefully you don't run right through that. Counselor Campbell, the floor is yours. Followed by Counselor Flynn and Counselor Flaherty, just so you guys can prepare.
Thank you, Councilor Arroyo, and that is wonderful. And thank you again to all of our panelists. This information, of course, is helpful not just to us, but also to constituents who are participating and also watching. So thank you so much for your work. I guess my first question is for Chief Martinez and Dr. Lowe on just outreach, right? You know, access, ease of access. I think, you know, Sandra just said it best, that sort of peer-to-peer education that's critically important. So are we currently offering grants or resources to create, whether it's, you know, these partnerships between a hospital, community-based health center, and maybe a community-based organization that has trusted relationships with residents on the ground to help us get out that information, to help us create points of contact for folks to be able to follow up with someone if they have questions, and then of course ease the process in either setting the appointment and getting to an appointment. So curious if we're offering any assistance financially for these levels of partnership.
Yeah, so thanks, Councilor Campbell. So what we have done is the Health Commission has reached out to all health centers to basically do two things. One, ask them how we can be supportive, right? I mean, there's things that the state controls directly with the health centers that we don't control, but to ask health centers, how can we be supportive? Is that about staffing? Is that about financial resources? Is that about advocating that you need more doses? What are those things that we can do? So we've reached out to health centers, and the relationship with each health center is a little different. So some need some help that we've been able to start to provide. Some have asked for help with outreach. Some have asked for help for other locations to vaccinate. And so we've been engaged in that effort basically for the past several weeks with health centers. In addition to that, we did allocate, in partnership with the Boston Resiliency Fund, a set aside of grants that are available for community-based organizations, including some health centers, who will be able to use that for vaccine education and awareness. Those grants should be going out next week. And we're really targeting making sure that, because the health centers play a critical role, and all the health centers on this call have done that, but community-based organizations also who don't provide any healthcare, they play a critical role, whether it's food delivery, whether it's organizing in the community. So we also want to get some resources into their hands to be able to do some of that ambassador work that you mentioned, which is going to be really, really important. So we're starting to get funds in organizations' hands related to the Resiliency Fund. And then we also anticipate supporting the health centers to do the same level of work based on their specific needs.
And then a follow-up question, you know, obviously as we get people to sites, I know all of us have helped residents create appointments and get to a site. How do we ensure or monitor the existing sites that in terms of making sure there is seating for our seniors, making sure there are staff there who speak different languages? We've heard some concerns of folks showing up, say at Fenway, and only English is spoken. So how do we ensure and monitor that all of the sites are truly creating, you know, have the language access, have the seating, have everything a constituent needs in order to navigate that easily?
So definitely our health center partners that are on here, they probably know this work better than most, right? Because it's the communities they serve, it's the communities they're embedded in. And so I won't even pretend to, we're not telling the health centers how to reach their populations and serve them, because they would cut me off right here on this webinar if I did. But say to you is that for the other sites, for example, the pharmacy program that's gone into senior buildings, for the Fenway site that's run by the state and coordinated by the state, we have done both site visits and have had ongoing dialogue about cultural competency, about seating, about age, age competency. So again, we may not control those sites, but what we're trying to do is bring that layer of, ensuring that that layer of cultural competency is there, and advocating around how do you not just rely on a translation line, but how do you make sure staff and volunteers reflect the community? It's some of the work that we've been trying to do on the ground ourselves with the one site that we currently run at Reggie Lewis, but it's also part of the work we're trying to do to make sure that we can provide the technical assistance to sites who need it, so they can make sure that they're reaching them. But we share that commitment, Counselor. We need to make sure that you can lift up all the sites you want with all the doses you can, but if you can't do the legwork to get people there and to keep people wanting to be there and tell everyone else about the experience they had to get vaccinated, you won't be able to vaccinate them as many people as we need. So we're working on that in terms of the support, and trying to make sure the state does that same level of work, since they control where these sites open.
And then my last two questions is one on the data piece, because it is so critically important, particularly how we target it, is any response from the state on when they're going to get us Boston specific data. And then the last is on the waste piece. We've heard from some that there isn't any waste, and then others saying there might be. In terms of creating a wait list, sort of an immediate list of folks we can call. Do we start with our senior buildings? How do we generate folks onto that wait list so that we're not wasting any vaccines? And then that's all I have. I can wait for the next round.
So I'm going to have Dr. Lowe talk about the data and the wait list piece. Dr. Lowe?
Yes, so right now the data for vaccinations is collected in the Massachusetts Immunization Information System. We have been working directly with the state on developing data access with specific demographics for Boston specific data. We hope to get that information by next week. Again, this has been in the process for the last couple weeks. Starting next week, we'll have just the raw data, and then moving forward, we're working to get a report. So we're hoping that will be readily available. I do want to point out that this data is collected directly from the vaccinators. And so, we encourage all of those who are vaccinating to collect appropriate data, but it's data in is what we get. And so we really have to have that conversation about the importance of collecting that information for all our vaccinators so that we have accurate information when we evaluate the data.
And then the only other thing, based on what you asked, Counselor, is that the wait list, every site running has a method to create a wait list. So for example, at the Reggie Lewis Center, right now we have a wait list that is either as a combination of folks who made an appointment and missed it, a combination of folks who show up hoping to get it walk-in, but who are eligible but don't have an appointment. We put them on a wait list, as well as we've already had the Age Strong Commission work to identify seniors over 75, and the nonprofit partners like Central Boston Elder Services and Ethos and others create lists of folks who would be eligible but maybe haven't had an appointment as of yet. So we work really hard at the end of the night to make sure no doses go wasted, as do so many of our partners, somewhat both an art and a science at the same time.
Thank you. I can wait for the next round. Thank you. Thank you, Councilor Arroyo.
Thank you, Councilor Campbell. And that was exactly 5 minutes when you got off that last question. So I appreciate that. Councilor Flynn, followed by Councilor Flaherty, followed by Councilor Wu. But Councilor Flynn, the floor is yours.
Councilor Arroyo, could Councilor Flaherty go before me? He has a prior commitment at 2 o'clock.
That's fine. Councilor Flaherty, if you would like to go before Councilor Flynn. Councilor Flaherty. You're unmuted, Councilor Flaherty, so I can see you're here, but I don't know if you can hear me.
I find ebbs and flows
All right. I'm gonna go, Councilor Flynn, if you don't mind going until Councilor Flaherty is able to actually.
He said his volume just failed.
I can hear you now, guys. Can you
There
hear me?
There we are, Councilor Flaherty. Yep, you're there.
Thanks. Thank you, Mr. Chairman, and thank you for the professional courtesy to Councilor Flynn. And I think Sandra summed it up best. Obviously, it takes a village, and while it's easy to sort of, I guess, nitpick and Monday morning quarterback, this is a massive undertaking. I just want to recognize the great work that our Chief Martinez and all of our local hospitals and our health centers and our healthcare providers and workers have been doing since the start of this. And clearly the vaccine rollout, there's been some snags, but the question, I guess, is how can we, as members of the Boston City Council, how can we be most helpful in reaching out to people to get this vaccine information? As referenced, that it takes a village. It's going to require all of us to get folks to the vaccination sites and to get them vaccinated. So how can we better leverage our platform as counselors? And, and also, where have we improved over the last few weeks? What have been our biggest stumbling blocks in moving forward? How can we make sure that that the communities and populations and the demographics that have been disproportionately impacted are being best served by this rollout? And how are we as members of the City Council, me in particular as an at-large member, what else can I do to continue that partnership with you, Chief Martinez, your team, but also our hospitals and health centers, to do my part as an elected member of the council, but also to encourage my colleagues and folks in the community to do their part as well. Again, it takes a village. It's a case of first impression, and we're hitting kinks along the way, but instead of being cranky and Monday morning quarterback, I want to be optimistic. I want to be positive. I want to be glasses half full, and I want to do my part to help you guys continue to do the great work that you guys are doing that oftentimes gets left out of the equation. So thank you, Mr. Chair, and thanks to my colleague for allowing the courtesy.
Thanks, Councilor Flaherty. Appreciate that. I mean, I think for us from Health and Human Services and BPHC, I mean, all the work that everyone can do to continue to remind folks of, the difference between fact and fiction a little bit, between what we're seeing around the vaccine, what we know about it. It's a complex endeavor that our hospitals and health centers are doing an amazing job right now, trying to lead in partnership with the state. And so helping to make sure that we're clear about, the vaccines itself, understanding the eligibility. It's been unfortunate to see essential workers pitted against seniors in social media and in different places. And it's not the intention, but when you have limited doses, not everyone's going to be able to get it when they want it. So there is definitely support needed to make sure that all of the elected officials can lift up messaging, lift up access points, but also identify gaps. We've appreciated hearing from certain counselors, here's a gap, or here's a building we're working on, or here's a way we're trying to create access. And so we just appreciate that every single week. I'll leave with this: the health inequities, the COVID-19 Health Inequities Task Force meets weekly. And every week we're talking about what's the plan, where are we at, what are the gaps, and then we work to roll up our sleeves and figure out the gaps and work on solutions. And so appreciate anyone's help to be able to continue to do that as we keep plugging away. But that would be the main message that we would appreciate your help with. Thanks.
May I add also that I just to reiterate the myths versus facts. I mean, people tend to remember the negative and false sort of histrionic kind of information. If you could please direct people to factual resources. BPHC does have a website up now. Boston.gov will have a connection to that. And just as reliable information, I think many of the community health centers are reliable sources of information, and they have their own websites. So we just want to direct people to resources that are factual. So that would be really helpful. And then the second part is just to remind people that, we talk about, we're so focused on vaccines, but I mean, really the idea is that we want to get through this pandemic. And so the vaccines, the masking, the social distancing, the hand washing, it all has to be into play. Obviously, the more people that get vaccinated, the more quickly that people get vaccinated, we can get through the pandemic more quickly. But until we're down to 0 cases a day on average, we really need to continue with these public health strategies. Thank you.
Thank you very much. Councilor Flynn, followed by Councilor Wu.
Thank you, Councilor Arroyo. Thank you, Councilor Campbell, and Councilor Arroyo for chairing this important hearing. I want to say thank you to the panelists, the community health center professionals, the medical personnel that are on here. Specifically, want to say thank you to Chief Martinez and Dr. Lowe and Rita Nieves. I've worked with you for the last year on this outreach. I want to say thank you for your leadership. I know Wanda and Sandra mentioned some of the points that I wanted to focus on, but the digital divide we also see in our city and state is very challenging, to say the least. I was at BCYF Josiah Quincy yesterday, and the digital divide in Chinatown is there. So we want to make sure we can reach as many residents. Language access is a critical component, and the outreach is also very important. I do plan to have a discussion with the Chinatown community sometime next week. I know I've reached out to Dr. Lowe and plan to have a outreach to the Latinx community. I represent a large Latinx community. I know Chief Martinez and Rita and hopefully Manny Lopez can join us as well. You've been very, very helpful. One issue I wanted to flag is, as it relates to communities of color, the Chinatown community has the highest asthma rate of any neighborhood in New England for various reasons, but it's not part of the precondition. I just want to know, is there something that we can look at where we make sure that the Chinatown residents are factored in, knowing that asthma is not part of the precondition, and we have the highest asthma rate in New England. There's also a lot of mistrust of government, language access, some immigration issues. I support undocumented residents as well, but a lot of those issues are impacting the Chinatown community. Again, I've worked with Dr. Lowe and Marty Martinez on a lot of these issues, and I want to say thank you for your great work. And any comments, just want to throw it open to the panel.
Thank you, Councilor Flynn. The only thing I would ask, obviously, or not ask, but I'd mention, obviously, the classifications of comorbidities and what puts people at risk. The state sort of did that through their panel of clinical and medical providers and experts. So again, it's a list they created. I know that they've heard the feedback about not having asthma within the list and what that means. And so again, I know that we also lifted it up to the state as part of a conversation about feedback that we were hearing, as well as about categories of folks. So I don't know, Dr. Lowe, if you have anything to add about that, but I do know obviously that fits into the state. The one thing I will say is I know you've also reached out, which I think is important for folks to hear in the community about, our senior buildings and folks in buildings. About 70 buildings across the city have either already have had their first appointment or will have a first of 3 visits by a pharmacy through the federal pharmacy program, where people will get vaccinated on site. There's a whole nother about 55 senior buildings that don't qualify for that program, including our BHA senior housing, and we're working through that to help them find clinical partners as well. And some of our health centers are likely probably already playing that role in some of our neighborhoods, but want to make sure that obviously there's buildings where seniors live where they're not going to go to a location and they need that to happen on site. So we're working through that as well as in Chinatown. But Dr. Lowe, I don't know if there was anything you wanted to add regarding the asthma as part of the comorbidity list.
No, I agree with what you're saying, Chief Martinez. I did want to add, though, that we have been working very closely with our clinical partners in the Chinatown area, specifically Tufts, and we have reached out to South Hove as well. And one of the things that has indicated when it comes to vaccine hesitancy and getting success in getting vaccination is that the primary care provider or healthcare partner that is a trustworthy source. And so we really want to again, we thank you for all the community health centers and hospitals that are on this call. That you are trusted members of the community from this perspective, and so we really want to we really want to encourage our residents to can make that connection. And so again, we're working closely with them to ensure that vaccine is accessible to those who are eligible.
So, hi, I'm sorry to interrupt. It's Wanda McLean. I just have to run, and I did not want to be disrespectful to Councillor Flynn and to Chief Arroyo. So thank you so much for having me.
Thank you for being here.
Thank you, Commissioner. Thank you, Chief Martinez and Dr. Lowe and all the panelists. You're doing outstanding work. You're doing excellent work. You're working hard. You're very professional. Councilor Arroyo, I have no further questions.
Thank you. I believe next is Councilor Wu, but I'm not sure if she's having technical difficulties, which would make Councilor Mejia next, followed by Councilor Braden.
So I am having technical issues, so I can't turn my camera on, but can you confirm that you can hear me, Councilor Arroyo?
Sounds perfect, loud and clear.
Thank you. Thank you so much. Thank you to all the panelists, and thank you to everyone that has spoken and who has yet to speak. I can't wait for us to go down that line. I have a quick question for Manny. You know, I really do appreciate your statement about the vaccine hesitancy and this whole idea that not one size fits all. And I think there's a big difference between I will never get the vaccine and I won't get the vaccine yet. Can you talk a little bit about how neighborhood health centers are engaging with those two different kinds of people and what the city can do in this space?
Yeah, thank you. Thank you, Councilor, for the question. Yeah, from our experience, again, going up based on staff as well as 1,200 vaccines that we did last week alone in a short week, you know, there were many questions around the vaccines. Again, it is a peer-to-peer, I'll quote my colleague, Sandra, a peer-to-peer education. That's what we saw internally here. And town hall meetings as well, addressing certain issues. So as an example, we employ 85% of our staff are women. And there were many young women who were either looking to get pregnant or just had a baby and looking to do breastfeeding. So we held a specific town hall to address that issue, and we invited in one of our women's health specialists onto that call to help address some of those issues. So I think, you know, when we look at some of the populations, there's the folks that are the maybes, and I think they have specific questions related to their specific conditions or specific issues. And then there's the individuals who are really the hard no's. I think the maybes, usually, again, those are one-on-one discussions. The hard no's usually are general discussions. And I think if we could all participate in this knowledge understanding and knowledge sharing, not expecting the council or your staff to become medical experts in this area, but maybe we can help you with some, you know, talking points if you don't have it already, just to help answer the questions from the community. And then the second piece I would just add, sorry to go on, is we need to lift up the spirits. You know, we are all stressed. This has been a year that we'll never forget. And we're seeing that in our patients, in our communities. And we're seeing it play out in many different forms right now. There's anger, there's frustrations, you know, many that we could talk about. And I think it's our responsibility as leaders to begin to think about how do we lift up those spirits and make everyone really feel good that there could be a light at the end of this tunnel. And I think Dr. Lowe said it best, that this is about ending this pandemic and what can happen when we do end it. So
thank you for that.
You're welcome.
No, I appreciate that. I guess, you know, it's not so much of a question, but it's just kind of something as a statement that I think it's important to make, is that this situation really reminds me of the conversation that we had around the school closing. Do we stay? Do we close? Do we open? How do we, all of this sort of stuff. And I feel like this whole vaccine rollout, we knew that eventually it'd be something that we would need to contend with. And I'm just curious in terms of just the community conversation piece of it. This is something what we can learn from previous experiences and what we could do better moving forward. It's just that I feel like thinking about the Reggie Lewis Center and how that showed up in our neighborhood, but the majority of the people who were taking advantage of that site were not people who lived in Dorchester, Roxbury, Mattapan. I just think that we're always in reactionary mode. And I think that there's a lot for us to learn here in terms of how we function and how we work to engage other folks in these processes, that I think that, you know, whatever we do next, it has to be deeply rooted and centered with the lives of those who are doing the work and living the reality. And this is not to you, Mr. Lopes, this is just in general in terms of just the overall function of the city and how we can do a better job, even as city councilors working in community. I just think there's accountability that needs to happen across all. And this is a lesson for us to figure out when we're dealing with the next crisis, what can we take from what we've done really well and that we want to replicate, and one of some of the biggest pitfalls that we've encountered, because this vaccine rollout, I think that there's still a lot of hesitancy, particularly in communities of color, around the trust factor. And I don't see us really leaning into communities of color to really shape the conversation. And while I do appreciate the efforts that are being made, I still believe that there are a lot of folks who are not at the table informing the work. And that's why it's important to partner with folks who have the cultural competency piece down packed. And I'm happy to see some of them here today, Josiang and Senator Dan Wilkinson, who has been working with the Black Boston COVID Coalition and others, because that's who I really think organizations like that need to really continue to be at the forefront and in every conversation. So thank you for being here. And that's just what I'd like to say. Muchas gracias.
Thank you, Councilor Mejia. Another excellent example of time management. So I appreciate that. And if we could have Councilor Braden, and then I believe, unless anybody else has re-arrived or arrived since, I will close with questions for this first round.
Thank you, Chairman. Thank you to all the members of the panel for your presentations today and all the work that you do all day, every day. One question that has come up in our discussions out here in Alston Brighton was a question regarding how are we supposed to encourage people to make appointments when the state is requesting proof of insurance and ID. It's not required, but health centers and providers are following the state guidelines. And some local folks are really concerned that it is deterring people from making appointments, that requirement to present proof of ID and your insurance when it's not really necessary. But that's what's on the state site when you look at it. And anecdotally, we're hearing that, you know, if and I'm not, this is not proven data, but, you know, anecdotally, I've heard folks who, white English-speaking folks who go, they're not asked for ID, and it just seems to be a concern that we would wonder how it's been addressed.
So, Councillor, I'm gonna ask one of my health center executive directors to sort of answer the question about insurance and identification from your end. For example, at the Reggie Lewis site that we run we don't ask for ID or insurance. The state site does say that you may be asked for ID or insurance, but we do not ask for that at the Reggie Lewis Center. But if one of our health centers, it's more complicated for our health centers, so be glad to ask one of them to answer that.
Yeah, so Manny, dive in, but yeah, our goal is access. And so we are not requiring IDs for our patients, and we do ask for insurance information, but our patients know that it's not required, so it's not a barrier. So people do not have insurance, they feel very comfortable letting us know that they don't, and we will continue to just document that and treat them. So we're trying not to make those things mandatory. Definitely no ID. And the insurance, if they have it, they do. If they don't, we just keep going.
Okay, that's good to know.
Yeah, I think Sandra said it best. I think it's important to know that the reason why we ask for insurance is because of the federal grants that we also receive to help support the operation requires us to ask and bill insurance if individual has insurance. So we're not using federal funds to essentially subsidize the insurance companies. So we have to ask the question, but if someone does not have it or cannot show proof of it, it's not a barrier to care. We just move on and get them registered.
I think it's helpful that if our patients who come are familiar with you folks and they trust you. It's a little concerning that on the website at the state level that it's there, and some people might even decide not to take the next step because they don't. It's that mistrust of government that we're trying to mitigate in this situation. So thank you. That's the only question I had, Mr. Chairman.
Thank you, Councilor Braden. It was a good one. I believe it is now my turn. And so a lot of my colleagues have touched on specific things. I will just raise up that when we had the ICU guidelines back in, I think that was April now, one of the issues that I had with the ICU guidelines was it was supposed to be race neutral, but the decisions that they were making were certainly not having race neutral outcomes. They were going to have a very bad outcome for Latino and Black communities who had on this list, they were being ranked by the pre-comorbidities that they had to be less likely to get an ICU or ICU bed or a ventilator. And the issue I have with this, with where we're at now, and I recognize I'm just raising my voice up to this, I know this is being covered, the asthma issue is real. Asthma for Blacks and Latinos, we're number 1 and 2, respectively, in the city of Boston. And if we're trying to get folks vaccinated, specifically from our most vulnerable communities, we're going to need to make sure that they meet these eligibility requirements that are, quote unquote, race neutral, I'm sure, but are going to not have race neutral outcomes in terms of who's able to get in line for a vaccination at what time. And so I would hope that the state does look at that and thinks about that. And on that front, I will just say this for somebody who is watching this and is wondering why we're so focused on Blacks or Latinos receiving vaccinations, or why Councilor Arroyo is so focused on that. Here's why. 34% of the 1,000+ deaths that we've seen in Boston up to this point are Black Bostonians. That's a disproportionate number of what we are looking at for a population. 30-something%, it's like 33 or 34, the numbers change. 30-something% of these numbers are Latinx Bostonians. And so I think it's really important for folks to understand in the context of which we are talking about COVID-19, these communities are suffering through policy that creates either environmental racism that may, for instance, give you asthma, or all different numbers of historical decisions that have created inequities for health in these communities. And when we are talking about these death tolls, that's on us, that's on our government and the ways in which we put these communities in play. And if we are going to then take our responsibility as a government to protect those communities, we have to make sure that we're not just treating them equally, because we haven't treated them equally up to this point. We have to prioritize them. We have to be intentional in our actions. And one of the things that I am seeing in terms of our testing sites, one of the problems that I have with this is we're not seeing the numbers of Blacks or Latinos being vaccinated at the same rate as our white population. And there's a number of different reasons for that. And I think one of the questions that I have for you, Chief, look at me, it's late on a Tuesday. Chief Martinez is specifically, do we have at this moment enough vaccinations to actually meet demand? Not folks we have to convince to take the vaccine. Do we actually have enough vaccination in the state to meet demand?
So do we have enough vaccine doses to meet the demand?
That currently,
yeah, what I can tell you is we don't have enough doses for those who are eligible. Okay. We do not have enough doses for those who are eligible.
So that's perfect, because that gets to my next point, which is there is an education campaign. There is this idea that we want to get folks to say, hey, I didn't want to take a vaccine, but now I do. But now we're adding them to the back of a line that currently already exists. And that's obviously something that we're going to have to balance. And I think that's really important. From an operational sense, here are my questions. We have a Roxbury, we have RCC right there. We have the Reggie Lewis Center right there. What are we doing to ensure that Roxbury and communities that have been impacted, like the ones I represent, like Mattapan and Hyde Park, are receiving priority for these vaccines that do exist? What are we doing to, whether it's by area code, if that, what are we doing? What are the steps we're doing to make sure that we're reaching those communities specifically and intentionally?
Yeah, it's a good question. So, Counselor, what we've done for the Reggie Lewis Center, last week we set aside 20% of appointments that were then only made in partnership with community-based organizations that serve seniors of color and other vulnerable populations within the eligible priority groups. So we did 20% last week. This week we did 40%, which we set aside. And specifically what that means is that 60% of appointments this week were publicly available to be made through the website. And the other 40% we worked through our Health and Equities Task Force. We worked, Councilor Mejia mentioned some of these groups, but we worked with the Black Boston COVID Coalition. We worked with Central Boston Elder Services. We worked with community organizations serving communities and seniors of color and slotted them into appointments. So they didn't have to go through the public process to do that. And that's what we're going to continue to do, is set aside appointments and then work collaboratively with organizations to create access for folks to be able to get into those appointments. So you're absolutely right, though, to your point that most folks that are signing up through the publicly accessible sites are not communities of color. At the Reggie Lewis site last week, I think about 36% of folks who were vaccinated were people of color, and that was predominantly on the set aside appointments that we were able to navigate and make happen. So we want to keep being able to do that. Two things I want to note for the population, and you sort of hit on this, 75 and older in Boston is more white than people of color. It's about 55% of the population 75 and older in the city is white. So there's obviously more folks that are white that are eligible in terms of seniors. But also one of the things that I think is a challenge around it is we don't want to have anyone prove residency. We don't want anyone to have to prove show their license or anything like that. So we called it a Boston site. We said it was for Bostonians, but we did not have people forced to prove themselves when they arrive, because I think that's a barrier that we are not going to put in place there. So I do think it's a complicated piece, but we share the desire to make sure folks within the neighborhoods most impacted can get access to that site, which is why we set aside those appointments.
Yeah, I appreciate that. Thank you. I have two questions left. I'll try and do them very quickly. The first one that I've already raised to Chief Marty Martinez is transportation. As I speak to you right now, outside of my window, there is a snowstorm. As we talk about, February and getting folks there to these sites, if you're 75 years old plus, I don't want to put you on a bus and have you walk to a bus and get there. That's not a plan for me. Not everybody is blessed with a nephew or a niece who has a vehicle. Not everybody is blessed with that situation. And so, one of the things that I have heard, so just to save everybody some time on that, is that the best way to get that done is to get to them. Well, I haven't heard a plan yet to get to them. And so if you have heard that plan and you know what that plan is to get to people's individual homes to vaccinate them, please share it. But two, the thing I have heard is I've heard that there is a reimbursement available through the federal government for, say, the National Guard providing transportation for using those kinds of resources to do this. Are we aware of any kind of, and this goes to the operational standpoint, operationalized plan to make these kinds of vehicles or these kinds of things available to getting folks there? The more we go down this list, by the way, 75 and older is going to be a very specific subset, but the more you open up this list, the more transportation is going to be an issue, the more we're going to be talking about this. Has there been any starts or beginning on a plan to get folks to these centers? And if you've heard of one to get to folks, that's great, but I have not. But any plan to get folks to these centers?
Yeah, so transportation is obviously one of those issues. I will say specifically for the 75 and older population, the 8 Strong Commission worked to provide transportation through their senior shuttle service for folks to be able to schedule appointments to get to use the shuttle to get to locations. The MBTA ride was also brought on to make more vehicles accessible for folks to be able to schedule appointments to get access to locations. We do know hospitals have been working working through transportation initiatives for their patients specifically. I don't know if the health centers on this call have more information. And we do know community organizations have started to partner with and reach out to ride sharing programs to be able to link them to specific sites and locations. Finally, I'll say that we have explored transportation in terms of several bus companies who've reached out to talk about transportation. The problem is we're still in the days of COVID. So we cannot put, 20 seniors on a bus and transport them to a location for testing. That's not going to be something we're going to be able to do because of the precautions that we're in. And so I do think it's a delicate balance. It's why we need to have locations that are more locally accessible than just the big locations, which is going to be essentially important to that piece. Right now, in terms of vaccinating people in their homes, that is not a major strategy that the state has laid out. Currently, there's clearly not enough doses for folks to do that anyways right now. We haven't heard the state talk about that. We do know some hospitals are going to patients' homes who are, who have challenging health conditions over 75 and vaccinating them in their homes. But it's a very limited subset. So I think the transportation issue will be a challenge ongoing. It's a challenge that we explored around testing, which we were able to look at a combination of resources to get people access to get tested. So there's not one solution to this. There's going to be a lot of different solutions around the transportation piece. I don't know if our health center partners have anything to add, but that's the larger conversation around transportation.
Yeah, we're offering Uber Health, and I think there'll be an announcement soon around the partnership with Lyft as well to help our patients. So those who have a need today will be booked with the ride sharing service.
That's actually fantastic news. And so I look forward to hearing about that and getting that to folks.
And I'm sorry, I need to drop as well. Sorry.
But actually, you're all free to go, actually. So I'm done with those questions. So everybody who's on that first panel, you're all actually free to go. You can all drop unless you want to stay.
Thank you for the opportunity.
Thank you.
Thank you, everyone. Thank you.
Bye-bye.
And so with that, I'm going to go into our second panel, which due to some folks who had time restrictions, that's going to be Dr. Thea James from the Boston Medical Center, Dr. Robin Reisberg from the Boston Community Pediatrics, Dr. Paulette Denise Chandler from Brigham and Women's Hospital, and Shalini Kamal from Doctors for America is in this next group. If you're ready and able, Dr. Thea James, if you can start us off.
Thank you so much for the opportunity to be here today. I'm really grateful and to be here, and also grateful for the time to spend with my co-panelists. Just to state the obvious, Black and Brown communities have been hit the hardest by COVID, as we've been highlighting today, and they are also the most hesitant to take the vaccine. As a healthcare system, I have to say that BMC is deeply committed, and actually we feel a responsibility to get the vaccine in the arms of our patient population who lives in these communities. We are partnering with trusted neighborhood providers, including our community health centers, as Sandra Cotterell mentioned, and also with community leaders and community-based organizations to create a network of vaccine clinics to provide access in the communities where our patients live. We are also actively working to build trust and awareness about the vaccine and education to promote acceptance in the communities we serve. We've identified our highest risk patients, and we've begun vaccinating them under state guidelines over the past several weeks. And we will have the capacity to vaccinate both our patients and people who live in communities that have been hard hit by COVID, both through our hospital sites and at sites we are establishing in the community with trusted partners. To address vaccine availability, we have been working in close partnership with the city, with the Boston Public Health Commission, and our health center partners to establish these community vaccination sites. We are opening 4 vaccination sites over the next 2 weeks in Dorchester, Mattapan, Hyde Park, and Roslindale. Just yesterday, we hosted a community engagement event with faith leaders in the community, as well as other community organizations and elder or senior daycare organizations. It was an excellent turnout. It was great conversation. We mostly wanted to listen and to learn We also provided education about the vaccine and also provided people with documents, digital things, paper things, whatever they would need that would be helpful to them to disseminate to their populations and to their members and that type of thing. That group also provided very, very, very useful guidance and insights, including a need to engage younger residents in the community who influence their parents. And so that meeting was really held to help make sure that local community members have easy access to sites that are close to home. And I will take the opportunity to say that we would appreciate the city's partnership to help make their constituents aware that these sites are available and for them. And so I would say, in the interest of time, at an overall high level, we think that we most effectively reach residents in the most impacted communities by making it convenient, prioritizing communities with intentionality, understanding what matters to them and what barriers they have, also providing easy and unobstructed access to the vaccine, including with scheduling and that type of thing. Also providing easy access to information. We have a very diverse patient population, so materials in multiple languages, just basically a standard of how we operate, and also having trusted messengers. And internally, I'd just like to make a comment about internally. I mean, we are seeing what everyone else is seeing. We have vaccinated 71% of our employees. And in our own employee data, we saw how significant a challenge we face in supporting vaccine acceptance in our Black and Latinx employees. So there is a gap there as well. That we have had multiple different types of information sessions, question and answer sessions, education sessions where people are able to speak with physicians, pharmacists. We even have docs at tables where people can just walk up and talk to a doctor and get questions answered. These are all throughout the lobbies. We even have a night clinic. And so we're focusing now on an ambassador system, for people to talk to their peers as well. And so the only last thing I will say is that we feel that we all have a role to play in addressing vaccine hesitancy as officials, healthcare providers, and individuals, because I do believe it is a team sport, and that is the best way for us to actually solve and achieve our common goals. Thank you.
Thank you, Doctor. Dr. Chandler.
Hi, it's a pleasure to join this discussion. And at Brigham and Women's Hospital, MGB, we've done a variety of, included a variety of strategies to address concerns about the vaccine. And we do believe this is a public health, or it's a public health emergency, and it will require partnership across many layers of the community and, of course, within institutions. So from the start of the pandemic, we have been reaching out to our communities using our community health centers. We've distributed food and diapers, help with voter registration, as well as testing. And we plan to have Brookside as one of our vaccine sites for our patients, but also we've opened the Strand as a testing site that will also be a vaccine site in Dorchester. We have a community van that's going through various areas of Boston, educating the community, answering questions about the vaccine, and providing food, diapers, various clothing. We will be supporting the Reggie Lewis Center for the February 27th and 28th event, which is targeting increasing access to vaccines, specifically for the Black community. And we're involved in, reaching out to Black clinicians and others that will be able to administer a vaccine on that day, as well as answer questions. We have we've held a variety of town halls throughout this pandemic to address questions around vaccine acceptance and vaccine concerns. We continue to partner with Sportsman Tennis Enrichment Center, Rich Joseph, and Fasolo Jakutu. We have numerous research groups, All of Us Research Group, which is part of the All of Us Research Program. They have many community collaborators. So now we've started to do community conversations with those community organizations that are requesting town halls and seminars to answer their community collaborators, their questions within the community. And we have partnered with youth groups through our community health centers. Southern Jamaica Plain Community Health Center is very actively involved with the South Street Youth Center, and we're developing programs where the youth will be trained to address their peers, as well as others that may have questions about vaccine concerns. We have over 1,000 non-clinician employees that have expressed interest in being peer supporters. We believe that peer messaging is important. And of course, as Wanda mentioned earlier, we have, why the hashtag #MyWhy. And those are being put out on social media. Those employees that have been vaccinated, we're putting those #MyWhy on social media, and we're encouraging others in our community to create similar media content to counterbalance the misinformation that's being put out in the media. And we have a whole team equity group that's looking at how do we create effective messaging to balance the misinformation that's out there. And of course, we partner with Mass League of Community Health Centers. We've created videos with them and various educational formats. And we're continuing to do town halls. We have one coming up this Thursday with foster parents, and the list goes on. So we're trying to address access as well as information and questions about the vaccine.
Thank you so much. There's a plow, and thank you, Public Works. There's a plow going by right now, so just apologies to that, but thank you to our Public Works. Dr. Reisberg.
Thank you so much for this opportunity, Councilor Arroyo and Councilor Campbell and all the other city councilors on the call, as well as all the other panelists. I really appreciate the opportunity to be here. My name is Robin Reisberg, and I'm the founder of Boston Community Pediatrics, which is the first nonprofit pediatric private practice in Massachusetts and one of the first in the country. Today, I'm going to present to you our plan for increasing vaccination to Black and Brown communities, which is called The Power of the Pediatrician. So at the end of 2020, in the middle of this pandemic, I founded Boston Community Pediatrics, whose mission is to bring true equity to pediatric healthcare through the integration of behavioral health services, pediatric wellness and care navigation, and traditional medical care. BCP was started after years of working as a pediatrician on the front lines in community health with minority populations, listening to families and their stories, and really hearing what they wanted and what their challenges were that they faced as they navigated our healthcare system. Our theory of change locates us squarely at an intersection of an increase in access and an increase in relationship. And we believe this is the best way to shift disparate health outcomes. At BCP, we are mindfully and intentionally breaking down barriers to COVID-19 testing, counseling, and care, as well as building trust and relationship between providers and patients needed to successfully bring the vaccine to patients. We know that once we're able to obtain the vaccine and partner with many of you to be able to do so, our ability to partner with families in the pursuit of health through this increased understanding and trust, as well as our relationships, will uniquely prepare our providers and medical staff to engage in conversations around the COVID vaccine that we're doing every day. So our plan to really distribute the vaccine to the communities that need it most is a two-pronged approach. Essentially, we think that vaccines should be distributed to primary care providers where people have a trusted relationship and are already going to be seen. Additionally, we think that we really need to think about some unique ways of vaccinating specific populations through public-private partnerships, and that's what I'm going to talk about. So the power of the pediatrician is rooted in the idea that there is no better way to distribute the vaccine than through a trusted provider and partner in health. We've talked about people having lots of questions, lots of concerns, and what better way to allay people's concerns than by talking with their trusted provider. Imagine, and we feel that we are very well positioned to lean into our existing relationships and have conversations which will allay these concerns. Imagine if you were a parent who was eligible for vaccination and you came into your child's appointment, and during the time you got your vaccine at the beginning of the appointment, during your observation time, you were able to have your child's appointment, and then you would actually be able to leave at the end of the appointment and the end of your observation time. This vaccine would be given by your most trusted healthcare partner, your pediatrician. Parents would not have to spend hours sitting on the phone or computers trying to make appointments or dealing with the transportation issue that people have been discussing to get to these vaccine appointments. They'd literally be vaccinated during their child's appointment. Frontline workers, largely people of color, have borne a disparate proportion of the burden of COVID-19, as we all know and you all have spoken about. And we know that their jobs are not ones that can be done from home. So by giving them a vaccine at a place where they're already going by a medical partner, we're making it as quick and easy as possible for them. If we can get this vaccine to pediatricians and primary care physicians who can partner with the community organizations, we know we can get this done. Additionally, pediatricians are already used to vaccinating people all day long. We're fully versed in the MIIS system. And we also have a lot of experience with yearly flu clinics and how to vaccinate large number of people quickly. The other component of this plan involves a public-private partnership to distribute vaccines in an efficient and culturally competent manner. This plan involves education, collaboration, coordination, and we are confident that it will increase access to and acceptance of the vaccine. We are currently partnering with John Holland, who is a South End real estate developer who's interested and ready to help. He actually came to us and said, how can I help make this happen? He and another South End real estate developer, Mario Nicosia, have offered us space and are also willing to help us with refrigeration and freezer concerns. They are even, John Holland's even committed to help us store the Pfizer vaccine, which is a much more difficult storage issue. And another community partner, Neighborhood Villages, is able to help us provide expertise and support around operations management. We estimate that at the beginning, we'd be able to start at vaccinating 100 people a day with this model. And then our goal would be to increase that as we can. But it's not just, the goal is really to say who needs to be vaccinated and how can we do that in a systemic and coordinated approach. For instance, if there are community organizations that have eligible staff, how do we bring them together and do the vaccinations for their staff at the same time? An example of this, Neighborhood Villages is currently working with 9 early child care programs throughout Boston, a total of 575 teachers. They'll all soon be eligible for vaccination. Many of them are from—
Hey, Rosie.
Hey, Liz, how you doing?
I'm grand.
Liz.
Many of them are from minority populations. We would have a plan where we could work directly with these organizations and find out the best way to vaccinate them, whether it's the afternoon or the morning. Additionally, because we have a relationship with these organizations, we could provide education sessions ahead of time with the same providers who are going to be vaccinating them, be able to answer their questions and be able to make them feel more comfortable as to what will come when they actually are getting the vaccine. This is what we feel could be a model that could be used all over the city and state to increase vaccination rates. Neighborhood Villages, with support from Boston Community Pediatrics, has been leading the effort to provide weekly pool testing to early child care centers. And this has now become one of the models for K-12 districts in the state. And we know that we can do this coordinated effort together. We are once again ready to lead the way with a replicable and scalable model for vaccination. As we look, as a team of people in Boston from all different backgrounds willing to come together to vaccinate Black and Brown communities, I urge you to not think, just think about large organizations, but think about smaller pediatricians offices, smaller primary care providers who have these really important relationships with their patients. The patient-doctor relationship should not be underestimated during this difficult time and this time of vulnerability. And as we look to vaccinate those most in need of vaccinations, I want everyone to start thinking about pediatricians and truly the power of the pediatrician in this endeavor.
Thank you so much. If I can go directly to, I think we have 2 doctors here from, I just want to make sure I get the name of the organization correct. Mass Coalition for Health Equity. And if we can have Dr. Andrew Marshall and Dr. Otugo. I don't know if you are going together or separately, but in whichever order you prefer to go or however you want to present is fine.
Good afternoon, everyone. First, Thanks for having us here. Dr. Otugo and I not only represent the Massachusetts Coalition for Health Equity, who we've talked to you guys before on the issue of crisis standards of care, but we also represent the Office of Ideas and Brigham and Women's Hospital. As far as what we came here to emphasize, I think that the things that Dr. Reisberg, Dr. James, and Dr. Chandler have said have been fantastic. Dr. Chandler represents the efforts of Brigham and Women's Hospital in a way that, more eloquent than I can explain. We have done a lot of things on our part to try to educate the community as well. We've partnered with Dr. Richard Joseph, who you've mentioned, to put out a podcast. We partnered with scientists participating in the vaccine trials to get messages out there about, trying to reassure the community about vaccine safety. We have also, it's worth mentioning that, we're also working to get sites up and running, like at Gillette Stadium, to do mass vaccination. And we're open to vaccinating not only our patients, but would like to vaccinate the broader community as well, provided we're given the additional resources. I think the main reason that Onyeka and I are here today are to talk about the things that many of you guys have mentioned, which are the fact that, the vaccination sites don't seem to be equitably distributed. And the fact that the access to the vaccines don't seem to be equitable. And so ultimately, we're here to advocate for our patients and nothing more.
Yeah, I just wanted to add on to what Dr. Marshall was saying. Thank you again for the opportunity of having us here today. So community organizing is definitely needed, but this is needed in addition to hospital support as well as city support. We need to inform residents of where they can get tested and also address the additional barriers that they might have, such as language barriers. In addition to that, also, it was kind of mentioned earlier, kind of the difficulty getting to certain locations, especially given the snow, and also kind of like emphasizing the importance of like mobile vans and other modes of transportation in order to make sure that these individuals are adequately vaccinated and have the resources that they need during this time. But thank you again.
Thank you so much. And then finally on this panel, Ms. Pamal, I believe is how it's pronounced.
That's right, but I do want to caveat and say I'm not a physician. I'm probably better suited for the community leaders panel, but if you'd like me to go now.
We can do you then. That's perfect. We'll set you up for panel 3.
Okay, so would you like me to provide testimony now?
No, you can wait till then. That's perfect.
Okay, all right.
That makes sense in the context. Thank you so much. With that, then I'm going to go to Councillor Campbell for questions.
Just given the time, Councillor Arroyo, and just the patience of folks, I'm going to allow, I'd like the community panel to go, and then I can wait to any questions towards the end. A couple of them are actually for the administration, which I'll send, specifically around granting organizations on the ground resources, monetary resources to be able to do this. I had some more specifics there, including around the public awareness campaign, right? This is an opportunity to grant women-owned businesses or Black-owned businesses around public awareness, or businesses or organizations that have the transportation capacity, to your question. So I'll save that for the administration, but really want to allow other panelists to go.
Thank you very much, Councillor Campbell. And I will just say, we ran into hard stops with the administration, as often happens.
I know.
That left some questions on the table. So I'll make sure we get those over there as well, and stay on top of that. With that, I'm going to actually just combine the two panels. And so if we can have, and I'm looking at what they've told me is present. So if anybody has shown up, if you can just let me know. But we have Diane Wilkerson here for the Black Boston COVID-19 Coalition, Shalini Pamal for Doctors for America, Josiane Martinez from Archipelago Strategies Group, Claire Lewis Okalani, I hope I pronounced that right. If I didn't, please correct me, from ACEDONE, James Morden from the YMCA, and actually Sally Graham. I can't tell if that's you in the attendees list because it just says Sally. So if that is you, please raise your hand so that I can put you in the group. And if anybody has a first name only and they're here for a public comment, please change it so that we have your full name. Thank you very much. And so with that, I'm going to start with Ms. Pamal. I guess since you're there, we'll go with you first.
Fantastic. Thank you so much for the opportunity to speak with you all this afternoon, Councilor Royer, Councilor Campbell. Really grateful to be here. I want to convey my perspectives from a step back. I think that our physician medical community has the expertise to contribute as it relates to vaccination sites and the mechanisms by which we are actually setting those up. My perspective is informed by community organizing and health advocacy experience. So my affiliation with Doctors for America is as a public health professional. I've been in Boston for 11 years now, first as a student at Harvard, where I was the community organizing chair for Phillips Brooks House Association, as well as a national campaign leader for Doctors for America before joining their board. From there, I served as a grassroots campaign leader in the effort to confirm our current Surgeon General, Dr. Vivek Murthy, during his first term in 2014, and worked fervently to mobilize public health and medical communities there to support his confirmation. And most recently, I've applied that to community organizing efforts in civic engagement and voting campaigns this past year. So these experiences collectively have required me to have a deep understanding of political, socioeconomic, and cultural realities faced by communities that must inform our public health communication and engagement strategy in order to effectively support these populations, and particularly those with historic marginalization and disenfranchisement. There's been so much rich information and experience shared here already, so please excuse any redundancies as just a reaffirmation of how important these points are. I'm going to share my screen momentarily just to make it easier for you to see the points that I want to make as far as 3 recommendations that I can share from my own work in the community as an independent organizer of mutual aid efforts, as well as a community organizer in local and national campaigns around public health and health advocacy. These recommendations are intended to not only thoughtfully work with communities on vaccine education and access, but also consider the broader context within which these public health hesitations and engagement challenges exist. Please excuse, I'm also trying to speak really fast so that I can make it under 5 minutes, but all of this is in written testimony as well. The first point being considering a vaccine education and access strategy that is contextualized within an asset-based approach in order to increase our potential messenger population, as well as expand outreach capacity to deliver that public health messaging. So this might require local partnerships to identify existing forums and community programs that already have strong engagement and longstanding presence, tailored messaging to address specific needs and concerns within distinct populations, and intentional spaces that provide trusted leaders with updated and ongoing vaccine information. Mutual aid networks, just like the one that I had started in early April, have emerged and are flourishing across Boston, Allston, Cambridge, Brighton, and all enable direct aid and financial redistribution during the pandemic. And these might also serve as a locus and a trusted resource for information exchange. The second point here is around dedicating more energy and resources to the policies and initiatives that address poverty, joblessness, housing, food insecurity. This is not just a public health crisis. It is a pandemic that has laid bare dual burdens of an economic crisis as well that exacerbate existing inequities. So trust in and enthusiasm for the vaccine and for vaccination can't be generated without attention to these broader social determinants of health. The pandemic has exacerbated food insecurity, housing insecurity, job insecurity. Women are leaving the workforce altogether to serve as caregivers, and forecasts show that the labor market's not going to return to pre-pandemic levels until the end of 2022 at best. With widespread job loss, cost-burdened renters in the low-income housing market are particularly vulnerable. And this is all compounded by language access barriers. And that's been particularly disproportionate as far as research has shown within the non-English speaking Latino patient community. My colleagues at the Mass General Brigham Network have reported a 35% greater chance of death and lower use of telemedicine services. And I'm sure this must extend as well into other non-English speaking populations. So our vaccine outreach strategies and campaigns require an interdisciplinary approach, given that we're experiencing a multidimensional problem. Health is embedded within all the policies and places where we work, eat, play, pray. So toward that end, we can build trust by employing different messengers and breaking down silos across council committees. So this is not just a charge of the public health division, but also collaboration with diverse network leaders to address safety and health. Lastly, creating local community advisory boards, I think, is a key recommendation to engage diverse leaders and enable bidirectional engagement for tailored outreach and education strategies so that we can consider the ethnic, racial, socioeconomic, political, linguistic diversity of each municipality. Those demographics in Mission Hill versus Dorchester versus Roxbury versus Mattapan. I mean, vaccine hesitancy is not monolithic. I think some of my colleagues here have made that very clear. And so for some communities, it's rooted in historical and current marginalization. For others, it's due to insufficient data on long-term vaccine side effects. And for others, they're convinced by misinformation. So acknowledging that this requires a pace and approach that is unique to each community and not only employs the right messages, but also the right messengers is really key. So trusted community leaders should be prioritized as messengers and considered with a broader context. These can be artists, musicians, teachers, nonprofit organization leaders, religious leaders. I'm going to speak to students at Charlestown High School in March through their Diploma Plus program, starting there with youth who are, who have influence in their households. These individuals can all serve as effective ambassadors along with translators and interpreters. And so finally, I just want to say the effort to educate, inform, and inspire vaccine confidence requires a commitment to making the process clear, transparent, and compassionate, with an eye towards our community connection and the assets that we already can leverage within these places. So when we consider all the strategies and tools available to us, this is our charge. Thank you again very much for having me be part of the panel.
Thank you so much for that presentation. I deeply appreciate that. Former Senator Diane Wilkerson here, I believe.
I'm here. Can you hear me?
Yes.
Mr. Chairman, thank you. Good afternoon. I want to thank you, Councilor Campbell, for the invitation, and to the council really for convening this. This is so important. I'm going to be brief. So much of what is going on, I think, on the ground has been said, but here's the thing. We knew, and I would also say that I'm here on behalf of the Black Boston COVID-19 Coalition. For the benefit of the council members, we came together back in the end of March of 2020, actually 1 year next month. There are now 240 members of the coalition. They represent clergy, residents, or nonprofit organizations, executive directors, doctors, lawyers, you name it, community activists, community organizations. It's been an incredible, we have police officers and law enforcement on. Here's what we knew from the beginning, that when we heard about this thing called coronavirus, which is what we all called it a year ago, that it was bad. That's all we knew, it was bad. And so we also knew intuitively that if it was bad, we were probably going to get more of it than everybody else. And so our first conversation was about that. It turns out we were right. We don't like to be right, but we have been really focused on drilling down on what's happening in Black and Brown communities around, well, we really focus on Boston. So I just want to be clear, we're focused on Boston, but certainly we know. You should also know that there is a Black Boston Coalition, COVID-19 coalition that was started in Springfield as a result of what we were doing here. So we certainly knew that the racial disparities were real. You can't get more real than what you said, Mr. Chairman. 1/3 of the deaths have been Black Americans. Almost 160,000 people who were literally walking around in this country somewhere a year ago today are dead. And the numbers don't seem to be waning. So it doesn't get much more serious than that. We knew it. We knew that the vaccine conversation, if we didn't do what we needed to do, was going to further exacerbate the disparities. And yet I am not hesitant to say that I believe that every single pivotal conversation that Governor Baker has made, and that's really where the decisions are being made, has only further exacerbated it. And it can't be because we didn't know. You mentioned this at the outset. I'm going to give you a couple of examples, talk about what's happening with the Reggie Lewis, and then I want to be able to answer questions. So the issue around who is accessing the vaccine was exactly the same issue we fought with the administration for 4 months about getting testing. It took us from March to July to get a mobile testing site in Roxbury. We focus on Roxbury, Dorchester, Mattapan, Hyde Park, and Rosendale because that is where the majority of the 160,000 or so Black and 170,000, 80,000 Latinos live in our city. So that's the focus of our community. We know that life expectancy for Black males at the end of 2019 was 73.2 years of age. 69 years of age, and for Black females, 73. Notice that neither of those numbers is even, so we have a 75-year-old age limit requirement because we think we're getting the most vulnerable. Christ, we're not even close. Sometimes to treat folks the same, you have to do different things for different folks. And that's really the position that we take. If we were really doing what we say we want to do, and that is targeting vulnerable communities, we would be doing this totally different. We would be targeting people who are in that vulnerable age group. And why it may make sense for 75 to be the age limit for white males and females, it makes no sense for that to be the age limit for Black and Latinos. It just doesn't. Our life expectancy is very similar. 26% of Boston, Boston Black population, 25%. And you mentioned 34% of the deaths. That ought to tell you something. We are, in fact, the widest gap between a percentage of population and deaths from COVID. In fact, I think for white residents of Boston, it's 44%, and they have 44% of the deaths. That would be, can you imagine that would be a welcome situation for us, that we were dying at the same percentage of the population? Right now, the Boston Black COVID-19 Coalition is working feverishly. We have co-partnered with the city of Boston and CIC, the company that has been hired by the Commonwealth to manage the Reggie Lewis tract. So much of the press in the last 10 days, there's been an article every single day, if you think about it, about the disparities. That in and of itself is because people like yourself and the counselors are talking. And so it's changing a little bit of what the governor's doing. We're still not there. I can tell you that when we started our tobacco cessation program in the 90s, we were targeting Latino teenagers and Black women, because that was where the industry was targeting their money. We had a requirement that 20% of that tobacco cessation money had to go to culturally competent and ethnic marketing firms. Every one of them that you can imagine was doing work around fashioning a program, fashioning messages. This administration, despite the fact that they've now received over $3 billion from the feds, it's not even our money, right? Like, they get reimbursed for 100% of what they do, has spent a total of $2.5 million, hired one Latino company, one Black-owned company, and he's bragging because they have a message. Our fundamental problem right now, if you want to know what's not working, is that our folks are not in the wavelength, they're not in the position, they're not in the space where they're even hearing about what's happening. It's not that we have an overwhelming number of people who are hesitant. Right now, I'm getting pictures text to me about the large number of Black seniors that are at the Reggie Lewis today. The city of Boston pushed opening that center soon because they knew we needed to get something open. But the CIC takes over the operation of the Reggie Lewis on the 25th of this month. And so I'm grateful to the city that they recognize the need to do something. but they don't do the scheduling. We're on our third registration process for the state, and none of them are working. The 211 doesn't work. If you saw what happened in Framingham, the initial registration process. So we're having direct conversations with CIC and their tech person, Vinay Gidwani, and connected them with the Urban League around setting up a call center where we're going to be calling people that we're pushing. They're meeting with the Latino Health Network so that we'll be able to do the same thing for that population. I think that's the only way this is going to work. The most important thing that you all can do as city officials is to follow the money and watch the money, because somehow it's just not reaching. We're raising money. We raised money from Amazon and Blue Cross Blue Shield that we're going to have Uber and Lyft transportation for any and every senior. So when we're calling them to schedule an appointment, we're also going to schedule the transportation appointment. And yeah, we shouldn't have to be doing that. But for us at this point, it's about whatever we got to do to keep people alive, because the Commonwealth, the government, the governor has not been responsive. When Mijinte asked for a meeting with him this summer, he said, I already met with the Latino Business Group. What do you want? When we asked, Boston Black COVID-19 Coalition asked to meet with him, his staff said, he's too busy working on COVID. That's the level of response that he's taken this. Every time we've had a crisis, whether it was 4,000 people showing up on Talbot Ave, called them, no response. And I just feel that is the most important thing you can do. We're excited about what's happening at Reggie Lewis. We're insisting that they have Black doctors, Black nurses. They're supposed to be Dr. Santiago. He is the one who put us in touch with the folks at Brigham and Women. We're looking to do the exact same thing. So literally that will be the mass site, but we still have to have all of the smaller sites that was talked about earlier so people can get there. But we're in a race, really a race to get as many of our people vaccinated before we start seeing what is happening with this variant, because it's rolling over and rolling through communities, and particularly the South African variant and UK, it's devastating communities. It's now here and it's ravaging, and it's not even clear that our vaccine is going to fight them. And so, like I said, there's so much I could tell you and talk about this, because the coalition is doing vaccine every day. We're meeting with them today we've given them names of translators to translate all of the materials, but our folks don't know. We're in it and didn't know that Reggie Lewis was coming until the weekend that it was opening. So we have a major information problem. It's easy to talk about the hesitancy, and the hesitancy is real, but you got to also know that 50%, 60% of our people have no idea what Tuskegee is. They don't have any idea. That's not why they're not going. It's not about Tuskegee 50 years ago. It's about last week when they saw the governor say your priority. So let me put a site at Gillette Stadium. That's not where we live. And then of course, oh my goodness. So, your priority. Vulnerable Black and Latino communities are priority. So let's put a site at Fenway. Like, wait a minute. Hello, that's not where we live. And so he says, okay, fine. Okay, let's put one in South Boston. So Reggie Lewis is the fourth site. This isn't funny. This is so crazy, because it's so obvious that what he's doing is not making sense if the goal is to save Black and Latino lives. We got to get louder, and we got to stop being nice, because he clearly is not getting this. I don't even know if people understand that Reggie Lewis is the fourth site that he put in the city when he stood in front of a mic and said that the vulnerable communities, Black and Latino communities, are our priority. That's the problem. We got to follow the money, and we got to challenge him. And we have to insist that we are able to make the decisions about what's best for us, not him, because he clearly doesn't know.
Thank you, Senator Wilkerson, for that righteous anger. Well directed and well said. I'm going to go to Mr. James Morden, the President and CEO of the YMCA. And then just so folks can prepare, I'll go to Josiane Martinez after that.
Thank you very much, Councilor Arroyo and Councilor Campbell, for creating this opportunity for all of us to hear and learn all that we have been able to hear and learn this afternoon. This has been an incredible panel, and I appreciate having the opportunity to sit here and listen to such incredible eloquence on the part of so many folks deeply committed to making sure that we get this vaccine, as it's been said, in the arms of as many folks as we can. So, you know, I'm moved to share that I believe that what this conversation has exhibited is a community's response to the issue, and our collective commitment to partnering with each other to do whatever we need to do in order to expedite the vaccination distribution process, but also to share the information that needs to be shared in order for us to feel comfortable getting the vaccine. And we've got good reason for not being comfortable. Diane Wilkinson, Senator Wilkinson, indicated that not a whole lot of folks remember Tuskegee, but I do remember Tuskegee. It's part of my historic DNA, and so I suspect. Well, I already know that I have had the vaccine, the first shot of the vaccine, as part of work that I do in the YMCA, and I was hesitant and I was nervous. And it was because of that historic DNA that made me nervous. But it wasn't until I did a little bit of research and gathered a clear understanding of how this vaccine was created that I developed the confidence or comfort that allowed me to go forward with the first part of this vaccine. And that was knowing that, in fact, the research process, the development process had not been abbreviated. What had been abbreviated was the approval process. And that was important for me to know. And I think that that's information that we really need to share with the community. So how are we going to go about sharing this information, this awareness, and then also creating more of those opportunities, those spaces and places in the community where the vaccine can actually be administered? And I think the part of that answer is engaging our community-based organizations. I'm really happy to say that there are several hospitals that have been on this panel with whom the YMCA partners. Now they don't all know that we're partnering with all of them, but they don't need to know we're partnering with all of them. What they need to know is that we're open to partnering to get this vaccine out in the community. And so I'm really proud of our relationship with Dr. Joseph. I'm proud of my participation on the community advisory board for Beth Israel Deaconess Medical Center. But I'm really also very proud of the partnership that we have with the BMC, where we're going to be partnering to make sure that the vaccine can be distributed at our Hyde Park YMCA in partnership with the Greater Roslindale Community Health and Dental Center. Now, we also have 5 or 6 additional YMCA sites that could be available for the distribution of the vaccine. And so we're going to be looking for other partners to do exactly that. Because I think there was something that was said in this conversation, and that is that we've got to rely upon the trust relationships that many individuals who are leaders in the community and also many organizations have with the community. These are the community-based organizations that are serving the children of the families who must go to work each and every day through our community learning centers. These are the organizations that are providing emergency childcare to essential workers when essential workers needed emergency childcare. These are the organizations that have fed community and addressed issues of food insecurity and hunger prevention over the last 12 months. And so those are the organizations that we now must rely upon to disseminate accurate and clear information to folks about the vaccine. And those are the places and spaces that also need to be called upon to participate in the vaccination distribution strategies that get created in our city. And so with all of that, I'm excited about what I've learned today. I hope that there have been millions upon millions of Bostonians who've listened to this conversation so that they've been able to increase their awareness about the vaccine itself. And I look forward to working with many of you on this call to make sure that we're doing what we can to make sure the vaccine is available to as many folks as we possibly can as they become eligible for that vaccine. And that every effort should be made to make as many vaccines available to as many of our Bostonians and folks across the country, obviously, as we possibly can. So I will limit my comments to those and thank everyone for their amazing contributions to this conversation today.
Thank you so much for that. And I'm, as the counselor for Hyde Park, a Hyde Park resident, I'm obviously deeply appreciative that the Hyde Park Y is opening up their doors that way. I'm going to go to Josiane Martinez, followed by Claire Louise Okalani, I believe is here. And so after Josiane, it'll be you, and then finally Sally Graham. So that'll be the order, and then we'll open it up to questions. So Josiane Martinez, the floor is yours.
Thank you, Chairman, and thank you, Councilor Campbell, and all of the councilors for having me here. It's an honor to be here today, sharing with you my experiences. I'm going to share my screen because I did prepare a presentation for you. And what I want to present to you today is a couple of case studies in things that I worked in. Diane Wilkerson mentioned that there were a couple of agencies that were hired by the state. Yes, I worked with the state. I'm proud of the work that we did with the state. And I want to show you some of the things that I think could be applicable for this as we think about vaccine, campaigns. First of all, I'm the CEO and founder of ASG. ASG is a social marketing firm. All the marketing we do is marketing with purpose. We do marketing to leave people in a better place. And so I have two examples to present to you today: Community Tracing Collaborative and COVID Enforcement and Information Task Force. Like I said, minority-owned, one of the few minority businesses that have been engaged in some of these strategies by the state. These are some of the people that we're proud to partner. And basically to people, these organizations hire us to help them understand, develop, and execute their vision to change behaviors to basically help make people understand how important it is to access these services. So I'm going to go directly into my what I know, which is marketing. And part of this is segmentation, right? You can't put together a strategy if you don't understand who your audience is, right? And this is part of the issue with many of the campaigns that are there, that, okay, sounds very cute, but in reality doesn't translate to different languages. And it's an example that people haven't taken the chance to segment the population, right? To look, for example, when we work with the Community Tracing Collaborative, we look at the hotspots. We look at the languages that were spoken in those individual hotspots. We look at the number of cases. We look at the rates, but we also look at the socio-economical, level of these communities, right? And, important to say that Boston, is measured differently than the state. The state has some set of data, which is different from how Boston measures, the cases, right? And then you start, obviously after you do your secondary research and start, when we were hired by the Community Tracing Collaborative, it was in April. There was no time. You need to put together a campaign now, and it needs to be a campaign that is broad, but at the same time is granular, micro-targeted, and in multiple languages, right? So what we start is testing some messages, and we say, okay, we're going to start testing some messages online. And what we found is that messages that were initially created for social media that revolved around love and community safety showed the greatest positive response, right? That to answer that call, Community Tracing Collaborative, it was all about answering a phone call for a community tracer that you don't know and share information that you might feel that it was not the right thing to, especially for immigrants and Latinos and people of color and their experiences, sharing information with government and the trauma that they have lived through. And obviously, need to think about how to place these things. And a lot of people, okay, yeah, Hulu, Comcast, Pandora, WBUR, Spotify. But don't forget about our ethnic media, right? Because they play an enormous role in not only communicating, but influencing our community. And yeah, I put these people here, the majority of the media buys, forget about them. Right? The majority of the people who do media buys don't deal with Tele Boston in Haitian, and Ricardo knows them very well. Radio Concorde, or Ritmo Guanaco, or TNT Radio in Dorchester for our Vietnamese community, or our Hora de Noticia for Brazilian. It is important that we engage these people in the conversation because, first of all, we need to educate these influencers that already have a reach into the community, but they can be our ambassadors too. If we show them a little bit of respect and put money into, the programming, they'll make sure that you have more space that what you buy, to communicate the message, right? And then how do we make this in multiple languages in a way that is faster, right? What we learned also is that we cannot, we can not do this without social media. Nowadays, the way to really micro-target, the most efficient way to micro-target people is using digital media, right? So our CTC paid ads target families in a specific hotspot, and this was a lot of work, right? By language, by geography, by language, by income, and we were tracking all of that, right, in multiple languages. In addition to that, this is some of the results that we achieved, in a very limited time. Our contract was basically a beginning of end of this advertisement campaign, communication campaign was available between the end of April and end of June. So pretty much not a lot of time to educate people about contact tracing. But because we were so micro-targeted, because we trusted on ethnic media, we got excellent results in terms of reach, in terms of impressions, in terms of getting the message out there in a very different way. Community town halls, and Councilor Arroyo here, our chairman, has participated in many of them. This is something that we started way in April, where we will get all these community leaders, to come and have an honest conversation, not a scripted conversation, an honest conversation that will take into consideration the legitimate fears that people have in the community about sharing their information. And, in that conversation, people came to understand, oh, well, I guess contact tracing is important and I will answer that call. And we did multiple town halls, and we combined, elected officials like Mayor Dan Rivera with community leaders and folks from the community, not necessarily leaders, right, to have this honest conversation. But what we made different is that we didn't just put a Zoom conversation out there. We went and talked to the Haitian radio producer and said, can you broadcast this for me? We went and talked to La Mega and said, can you broadcast this for me? Right? So we were not only broadcasting this on Zoom, we went to Alberto Vasallo and said, Alberto Vasallo, can you broadcast this for me? And then we're not only having a conversation in Zoom, but then we have 1.8 views in less than a week. 1.8K views in less than a week. This particular conversation here was in Spanish. All of them were in language, right? We have experts talking in the language of the community that we were talking and answering questions. And we were receiving questions through the chat and then answering those questions right there in the community. The good thing about doing these things is that they live on Facebook. People can come back to this link and continue to watch these conversations. At the end of July, 75% of the phone calls, we had a 75% call response rate, which is great, meaning people answered the phone, right? Based on after we finished that, we did some qualitative research, in August, and what we found after doing multiple focus groups with different groups in different languages is that they were aware of what contact tracing was and had an understanding of how it works. And that to us is success. And now let me tell you about COVID enforcement. At the end of August last year, I got a call. We need to put together a campaign to target those top hotspots in the community. And they said, Josiane, just need you to target these 6 cities and eventually become 11 cities, right? So we were hired by the Commonwealth Task Force to come up with a name, a campaign in different languages, a media buy, and also a group of more than 100 ambassadors from the community to go and talk to people in person. Segmentation looked almost the same as CTC. We're looking at hotspots, we're looking at languages, we're looking about incomes, we're looking at geography to make sure that we can prepare a very granular micro-target effort to convey our message. Right, the messages were around love too, because a lot of the research that was coming is like people would do this for the people they love. This campaign is still running, right? Full disclosure, I still have, some ads running, but I want to show you some of the things that are having an enormous success. This testimony from Gladys Olivero, it's only been on Facebook and Instagram for a week, and it's already having more than 100,000 views and more than 300 shares, right? Let me show you.
Hello, mi gente. Buenas tardes. Soy Gladys Oliveros. Estoy por aquí recuperándome en el Hospital Mass General de Boston. Queriendo llegarles a ustedes y pedirles que por favor se cuiden. Yo lo hice, yo lo traté. Yo creí que estaba protegida, pero no. Está en el aire. Esta plaga está en el aire. Y 2 semanas atrás, creo que no me lavé las manos como debía ser y empecé a sentirme mal. Al comienzo creí que era capaz de tenerlo en mi casa y sobrepasar, pero una semana después mis pulmones colapsaron. Empecé a faltar el aire, la respiración y bueno, debí venir al hospital. Ya llevo aquí semana y media. Por fin, mañana regreso a casa y ha sido difícil. No le deseo esto a nadie. Nuestras acciones tienen consecuencias. Por favor, toma responsabilidad. Cuídate.
All right. So while we have this campaign going out there, while we have all this communication in multiple languages, I also have individuals in different communities, 9 communities, right? Distributing materials, knocking on doors, creating partnerships. We distribute more than 1.1 pieces of, PPE. We learn about communities that they couldn't buy a mask, that they would rather have, reusable masks. We learned that communities were sharing masks. We learned things that were important, but most important, these people were part of community organizations, right? And, a lot has been said here about partnering with community organizations. So I fully agree with that. But there's gotta be a comprehensive campaign, a unified message, and a structure for those community organizations to work off, right? And there's gotta be data collection. 3 models of engagement: tabling, supermarkets where people go. If anything, people go to supermarkets and pharmacies. So we were there. Business walks, we were there distributing signs, right? We were partnering with businesses and saying, can I give you a hand sanitizer stand for your business? They will take it. And then we put together care kit drops because we found out that people needed this PPE and needed more information. They needed to know where the testing sites were. partnerships, like I said, partnerships with different with different organizations, but also with the boards of health, right? And making sure that they also have all of our content, right? Here are some examples of community in different communities doing standouts, going out there, posting signs, delivering PPE in barber shops, churches, beauty salon, bodegas. They all became our partners on this. But the point here that I want to make is that, if we want to think about campaign strategy, it has to be a unified campaign. It has to be consistent. I hate to see so many messages, that are, trying to communicate the same thing. I think that's not going to work. Also, it has to be culturally relevant. And this is not just about translating, please. Translating is great. But if you don't make a message from the beginning culturally relevant, it's not going to go anywhere, right? It's about understanding your audience. Peer-to-peer, yes, that's what works. We want peer-to-peer. What I would recommend is a structure for the community organizations, right? In where they can report data. I recommend a GOTV vaccine campaign where we go door to door and we talk to people in their language, and we collect data about the levels of hesitancy that people have, so that we can come back to the boards of health and say, well, we have a problem in Hyde Park. We probably have to come back and recalibrate our message. I do believe that we need mobile vaccinations. DPV strategies is partnering with Mass General to do testing in East Boston and other hard-hit areas. They are equipped to do the same, to bring vaccinations to the community. And in closing, I think, that everybody has the best intentions here, but we have to be intentional. Intention is what matters, right? And that shows when, messages are created in silos and really don't resonate with the community. Thank you so much for this opportunity, Chairman Andrea Campbell, and sorry that I took a little bit more time than what I had.
Thank you, Ms. Martinez. Ms. Okalani, and if you could just make sure that I pronounce that correctly, because I think giving people their names is important.
Yes, Counselor, you're absolutely right.
Oh, I keep getting lucky with this. I appreciate it. Thank you. If you could present, please, followed by Ms. Graham. So the floor is yours.
Thank you, Counselor Arroyo and Counselor Campbell, for the invitation. To all colleagues, protocol observed. Thank you for all being here and sharing a lot of points that some I didn't know, and some that are pretty much the same that I'm going to mention in this meeting. In this hearing. Back to the former Senator Wilkerson said something very important. Different strokes for different folks, and I think it's crucial to have that cultural understanding. I'm sorry, I didn't get her name, but I'll get it. As my former colleague said, it's very important to bring that cultural aspect into the discussion of making sure these vaccinations are out. I will speak to what's going on right now with the community that we serve, which is predominantly Somali, but we also do Ethiopian, Sudanese, Tigrayans, Senegalese, and we are at a point, at a point where we have two forces, external forces, pushing against the messaging that's coming out about vaccinations. And one is having way too much information and not knowing what to do with it and where to go. And the other is getting misinformation. The latest one today is that the vaccine can turn people gay, which now we have to go back to the drawing board and talk about that. We can counter each of those independently and have discussions around that. But what's missing from this particular exercise is the social capital. You have to pay attention to the fact that, and Dr. Chandler mentioned this, social capital is very important. If we have worked with a lot of CBOs in the last 12 months around food distribution, necessities, PPE, these are the organizations that have built the social capital enough to make sure that this vaccination exercise takes place effectively. Another thing that former Senator mentioned, Wilkerson mentioned, is that time is of the essence. We are now, before it was a race towards making sure that people were not infected. Now it's a race against the variants that are spreading. There's the Brazilian, the South African, the UK variant. And we need to still keep the same energy. And that's something, and this was something I realized only after I managed to get back into the office. And we were talking about a coalition of CBOs that are trying to reach out, that have reached out to Boston Public Health and Brigham Women's. A lot of us actually came down with the virus. 98% of us actually came down with the virus, symptomatic, and we're still out here. So let's not underestimate how much effort and the intent of everyone on this call that we want to see this exercise happen. A suggestion would be providing resources to CBOs that you have already formed a trusted relationship with. As I can speak for ACEDON in particular, we have formed relationships with all the communities I mentioned, grassroots organizations I've mentioned, Sudanese, Ethiopian, and we have talked to a number of religious institutions and faith-based leaders. March 15th is just too far. It's too far. I have intergenerational households. And if I can assure these households that go as a family, get this vaccine, they're ready and willing to go. I have a lot of undocumented people who are sitting back and saying, well, I have a comorbidity, but I do not have, I'm not in the phase. So what do I do? I have a lot of questions surrounding the different phases that Boston Public Health is having at the moment. And everybody seems to think that they can get it after 6 months, even though they're willing. So it's also important to take into account ambassadorship, because that's also a form of social capital within these communities. If we can use a model, and I borrowed this from Beth Israel, live, work, play, pray model. I added the pray because don't underestimate the fortitude of religious institutions. We need, I'll speak for Muslims who are, Ramadan is coming up in a month, and getting all these mosques on board to have sites is definitely going to speed things up within that community, because this is the holiest month. It's doing right by everybody. And this is something that I think you can take advantage of. I won't take too much time. Everybody has made valid points. Oh, one more thing. Councillor Flynn was absolutely right about the digital divide. It's very real, and we need to streamline that as much as possible. Whether it's through CBOs and we have to do the calling, we have to do the reaching out, we are ready. So thank you for this time. I yield my time. Thank you.
Thank you so much. And Ms. Graham, and then we can go to the remaining councilors for questions. Ms. Graham.
Okay, here I am. Finally, I'm slowly getting up to speed on this. Thank you all for calling this hearing. Thank you, Councilor Campbell, Councilor Arroyo. I appreciate everybody's time and effort, and certainly I feel like I've been sitting in a seminar for the last couple of hours, just learning quite a bit. I am a resident. I'm a resident of Codman Square in Dorchester. I live right down the street from Codman Square Health Center. They have done a fabulous frontline job, as has the Dorchester Y. So I just want to give kudos to those two organizations. I think that I'm also work a lot with community neighborhood organizations and my neighbors and friends. And I think that there's a lot of chaos and confusion going on. It gets translated at the ground level with a lot of misinformation, and people are getting more and more frustrated, and a lot of that frustration contributes more to the vaccine hesitancy. They don't know what they're doing. I'm getting double stories. You have to have access on the internet. There are a lot of seniors in my neighborhood who do not have internet access, And when I tried to go on to help out a neighbor, I was directed first to Walgreens, where you had to have an account. So there was no account, so you couldn't get on through that. 211 was not up and running over the weekend. There is a state assistant number that doesn't operate on weekends. So I think that there have been a lot of missteps. I understand that the city is at the bottom of from the federal government to the state government's response has been abysmal, pathetic. And the city, I think, is starting to come together and get things done, but it's been a very chaos. I'm not telling you guys anything that you don't already know with the chaos and the confusion. I think going forward, there are a couple of things that I would suggest. One is there's a lot of cleanup that's going to need to be done at all levels within the city about what has happened and how all of the bumps and people are going to need to be, people being the messaging that goes out, and the people who are talking to people are going to need to be really transparent about the screw ups and the failures, and that they're trying to get it righted. Because, for instance, I called Codman Square Health Center the other day for my neighbor to see if she could get an appointment there. You had to be a patient. The person told us you had to be a patient. So that we scratched that off the list because she's not a patient there. But just now, she called me at the beginning of this meeting to say that she had run into another neighbor who had gone to Codman Square yesterday with an appointment, but two friends had gone with him who did not have an appointment. And apparently there was some excess vaccine, so they were given a shot. That is all totally appropriate. There's no problem with that, except that now a whole layer of misinformation has been created, because we were told one thing, you have to be a patient, and then she finds out from a neighbor who goes that they just got a shot. She didn't know anything about there being, excess vaccine or anything. So all I'm saying is that contributes to the mistrust and the distrust. There's all the historical stuff, information and experiences, which are very real and valid. And then, as pointed out, there were the more recent stuff that happened last week. So I think everybody's going to need to go forward with a lot of transparency and a lot of honesty and a lot of directness. And I think also the state has made it incredibly complicated. And I think a good message needs to be that keep it simple and make it so that people can get to it. I heard Senator Wilkerson talk about, Fenway and Gillette, which is just, it's absurd. Most people don't have cars, or if they're lucky enough, somebody can take them a couple of blocks. So that's about all I have to say. I think it sounds to me like a lot of people are doing a lot of really hard work in many different arenas and many different levels. And I think it is coming together, and it will come together, but there's still a lot of work to be done. And I think the closer that resources can be directed to the ground level, to the granular level, the more compliance and more people will overcome their hesitancy and get a shot. So thank you very much for giving me the opportunity to speak.
Thank you so much. And so for the remaining counselors, which I believe is myself, Councilor Campbell, and Councilor Mejia, I had time limits prior to this. I'm not going to have time limits on this because so many other counselors have dropped off. So there'll be one round, ask the questions until you feel satisfied. In terms of how we do this, generally speaking, when the panel is this big, which is why we separated initially to 2 1/3, it becomes sort of, trying to find the right word for it, but there's a popcorn to it where somebody has an answer for the question you ask if you just throw it into the ether, and then somebody else has a question or a response to that, and then somebody else has a response to that, and then we end up 15, 25 minutes later trying to get to the second question. And so if you can ask, if it's for a group of people, if it's like, hey, this question is for these folks, ask that. If it's, hey, this question is for this person, ask that. But if we can try to make sure that we have some intentionality with who we're asking the questions, that'd be fantastic. If you are in the attendees group, by the way, and you're here for public comment, if you raise your blue hand so we can start to get ready for you, that would be great. And with that, Councilor Campbell, the floor is yours.
Thank you, Councilor Arroyo, and thank you to this last group of panelists. You know, obviously you guys have busy schedules, you're out there saving lives, and to stay on this long, I am grateful. I will tell you, and I was telling Councilor Arroyo this offline, I'm a little disappointed that the administration had to jump off, because I want them to hear what you guys are seeing and experiencing on the ground so it can inform changes to their strategy, right? Or get them to think outside the box. So we'll clearly lift up everything that you have been saying, send that to them on ways in which we can do better. This is more, I think, directed to, maybe it's Claire, Josiane, Diane, or Senator Wilkerson. To start, I guess others could chime in, and it's a broader question. You know, I get frustrated, and I'm being very straight with whether it's internal briefings or conversations like this, where the city presents as if we're doing everything great and wonderfully. And then I get to this kind of panel, and it's not to knock and say we're not doing a good job, we're working hard, but we may not be impactful or effective in reaching the communities we need to reach yesterday to get them vaccinated. And so what I'm hearing, and of course I'm taking a lot of notes, is yes, we need to resource and grant organizations on the ground that have trusted relationships, and to think outside of the traditional community-based organizations too, whether it's mosque, religious, all kinds of folks that can play a role through this peer-to-peer contact to get folks information, to be a point of contact, to give them transportation and everything else they need to get that vaccine and get back home, and continue to have that follow-up to check in on them. Resources. But I'm also hearing, in addition to granting organizations some level of resources and monetary resources, we also need to be thinking about who actually is best to coordinate all of these players. Because one of the things I do not think we're doing well is coordinating all the players. I think that's just evident from this hearing. Everyone's doing some wonderful things. We all had to reach out to you individually to say, join our meeting. But we're not coordinating. I don't think we always do that best internally at City Hall. We're all working on it. We all are working on it. But then externally. So I'm curious to hear from your perspective, and maybe it's not the city that should be doing this, right? Maybe it's offering up more grants and resources to organizations externally to help us do the marketing campaign, the organization operations. But I'm curious to hear your response to that question, because I just do not think that we're doing an effective job of coordinating all these stakeholders, of ensuring we're delivering the same message, responding to the same fears, maintaining data, sharing data with each other. So I would be curious to hear your response, because otherwise I think we'll be back here in a month having the same conversation. Sorry, Councilor Roy, that can be a few people that answered. It was hard to direct. I think everyone has something to say.
As long as it's like in a realm of
yeah,
that's fine.
So, Councilor, I would say that if I could,
yeah,
our relationships and our connects have been different in phases. When COVID first started, when we were trying to figure out the what, we were trying to figure out the impact, school. Much of our conversations was with the city, and we were frustrated because we did not think they had answers. Right?
Mm-hmm.
The testing was this kind of the testing, tracking, and tracing was the next phase. We work with the city to finally get community health centers in the mobile testing in our community, because although right from the start they said communities of color, Black and Latino were the hardest impacted, but the testing was ringing our community. So we're reading every day about the massive testing going on, in Charlestown, South Boston, Brighton, you know what I mean? It didn't make any sense. And so that fight then became us and the city against the state. And the city ended up responding. And so just as an example, when we finally worked out the relationship with Whittier Street and Harvard Street to have them do the testing, we got a flyer the night before in June that we're going to do testing in Washington Park Mall. And I say the Boston Black COVID-19 Coalition, we sent it everywhere we could think of. They had 755 people who showed up the next day on less than 24 hours notice to get tested. It was 2 days in that first week. And between the Wednesday and Thursday, they had 1,400 people. And, they kept saying, well, Black community, they don't want to be tested. Yeah, they were looking. We have such a major lack of information. The vaccine conversations has been more an attempt to deal with the state because they're controlling so much of it. But what's happened now is that because, the Boston Black COVID-19 Coalition got a resiliency fund grant because the city knew that they weren't able to kind of be on the ground, knocking on the doors, talking about the testing. And so consistent with what Josiane said, we actually empowered several different partners. So we have the Cape Verdean Association responsible for that population. We have the Haitian Community Baptist Church. We have this is for Claire Louise, I wanted her to know, we have a partnership with the Activated Massachusetts African Community because they have a different dialects that we hadn't really thought about. So that's their role. Martin Vinay is our point person for the churches, the Black churches. Dr. Martin and Elmer Friedman are dealing with our wellness checks. They both have teams of young people we're on the call. We call the seniors every day. Shirley Shillingford is one of our partners from the Caribbean American Carnival Association because of their reach with the Caribbean community. And she has been our food partner because that food insecurity is real. So as we're checking on people, we have Priscilla Banks from BG. They're distributing gift cards. So we have a form. It's very, very sophisticated. If you haven't seen the website, please go take a look at the Black Boston Coalition website. It's fabulous. It's every day we update it. But you're absolutely right. The vaccine piece has proven to be so problematic. I've learned so many other people were involved in this process. I'm not surprised about that. I understand it. It could be more coordinated. But I think the point is that if we have 100 people out there just trying to get everybody we can vaccinated, then we'll be successful. And I think that it would have been nice to be able to do it. I'm not sure we could reel that in, Councilor Campbell. I totally agree with you. Because we're seeing it right now, and I would love to be stepping over people. There is a fundamental lack of a communication process on the ground. People across the street from the Reggie Lewis did not know that it was opening. Many of our people found out when they saw the newspaper article that 95% of the people who showed up on February 2nd were white people from out of the community or out of Boston. So the governor has made a commitment that they're going to have days set aside for Black and Latino communities. So we will be the exclusive users for Reggie Lewis. How we're doing that, CIC is developing a whole new registration system and a process because even they understand that the one they have now doesn't work. You can't do registration by saying everybody 75 and older, get online. The idea that was like somebody's, like that was a decision.
So it's like, Senator, whether it's the Black COVID Coalition, folks in various communities, the APIA community, right, who Councilor Flynn was lifting up, and we were trying to get some representation here. Everyone is doing incredible work. But what is the overarching strategy, right? Who's the point of contact? What's the timeline attached? How do we hold each other accountable, right, to what we commit to doing in respective communities? And I think there is a gap. And so for me, you're right. How do we as a city resource that, right? If we cannot do that well, because these are things we can be doing now, while of course advocating for the state to change criteria, to give us the resources, et cetera, to step it up. So that's the piece I really want to hear, some more on, is what we can do. Josiane, I saw your hand raised.
Yeah, thank you.
Coordinate each other.
I think there's a real opportunity here to provide, again, structure and management to, the strategy that everybody agrees that we have to get, to our community organizations and partners out there so they can amplify the message. But I don't think, these organizations are already limited with, management resources. So there's gotta be an intentional approach to manage this process. One unified message, making sure that all these community organizations are trained on the actual message that we're gonna bring out there. A data collection system that when they go into these homes and have these conversations, they can collect this data and we can see in real time, the levels of hesitancy that there are in the community. And there's an opportunity here, right? There's multiple folks that are unemployed right now. And that's something that actually helped us during our COVID enforcement information, because we went to these community organizations and said, I want you to hire 15 people, 20 people, and we'll pay them a good hourly rate, right? To work with us, and this is an opportunity to get them together, train them on something that they didn't know, give them new skills, right? And maybe I know some of these people after our campaign were able to find jobs with the community organizations, right? Because they didn't have those skills, right? So there's a workforce development opportunity here to train folks in the community, to empower people in the community so they can go out there. You and me would not know exactly where to go in certain neighborhoods, but they would know. They know who's the one who's saying it's not getting vaccinated. They know which doors to knock. So what I think it needs, and then again, there are good intentions all over the place. What we need is a unified, consistent, and managed approach in my personal.
If I could.
I'll go to James and then Robin, yes.
Thank you very much. I don't know that I could agree more than with Ms. Martinez around what she has just said, and so to the extent that the YMCA could be a contributing partner in that work, we would love to do that with you. I also am looking at Pamal. I like what she had to say earlier about us being deeply engaged in communities and organizing those communities around some of these issues, and of course Senator Wilkinson is always on the point and on par with what are the best strategies for us to move forward with. And so with all of that, I'm gonna get to my executive committee meeting because we're talking about our 2021 budget. And so we gotta get that budget done so we can survive as an organization and be able to continue to serve. But I am a willing partner. So please keep us in mind and let us know what the strategy is that comes out of this meeting, because I think that I can see it forming, and so please reach back out to me.
Thank you. Stay safe and healthy.
Thank you. Thanks for your leadership.
I'll go to Robin.
Thank you so much. I just wanted to.
Go ahead.
This is perfectly fine. This makes perfect sense.
Is this okay? I'm sorry.
Yeah. I saw your hands. I was just calling.
If you see blue hands up, question.
Technically, he's the chair. That's why I was like, thank you. Right? But I saw your hand. So.
This is just quicker and easier to do it this way. So this makes sense.
So I'm just, okay.
Chairman Arroyo, excuse me 1 second. I'm sorry. I have a board of trustees meeting at 4.
Oh, that sounds very important.
Yes. And Councilor Arroyo, while I appreciate just wanted to let you know.
Thank you.
That
Thank you.
I'm just trying to figure out what the rules of engagement are for this part, Arroyo, in terms of like how long are we going to go, so that way I can just handle a few things and then just let me know, because it's I'm just.
So the goal is to try and do this in one round for each person, so we don't have to just keep cycling through, and maybe we can get it done faster that way. Councilor Campbell's currently asking questions, and then it would go to you.
And then I'm done. That's right.
Yep. And so I don't know what the time frame there is on that, but that's it. That's the order. Literally, you're next.
I just wanted to talk about one strategy that people have been talking about that I really think is going to work as a medical provider, also who's able to give the vaccine, is really connecting. So many people talked about smaller organizations. And really connecting an organization with a medical partner. And I know, like in many cases that's happened on large scales. It sounds like with some of the larger hospitals and health centers, but I know there are so many smaller organizations. One group that I am really trying to work with is, as I mentioned before, early child care providers and teachers. They are going to be up soon. And what is a coordinated effort for us to get it done? And I think if, like again, as I talked about, we have a plan where we could get this done and we could get it done quickly. What I don't have is any vaccine. And I, have not been able to get that as a small medical institution. I'm new, I'm small, and, but I'm able to kind of do a lot of things quickly if I were to get it, but I don't have it. So I could work with Senator Wilkinson's groups and say, look, what group can come this day? Is Saturday better for you? Is this day evenings? I can be very flexible with that in community organization, but I need the ability to be able to do it and to be able to move forward knowing that I'll be able to do it. But that's where I think I'm always sort of start on the ground and move up. And so I'm, starting where the people are, what patients are telling me, what parents are telling me, what their concerns are, what their struggles are, and knowing full well what they've gone through in COVID-19, having to be home with their kids and having to leave jobs. And as everyone talked about, struggling with food and so many other issues. So if we do it in a coordinated way, we know who's coming in. We actually can even get resources to people at the same time that they need. And so how do we think about doing that all at once? So, I just want to say that I am willing to work with the city, the state, all of the city councilors, so many organizations, and I'm excited to do so. And I look forward to that opportunity.
Thank you.
And I'm going to go see patients now. So thank you again for this opportunity. I really appreciate it.
Thank you.
So
I'm almost done, Councilor Arroyo. I just, I saw Andrew and Shalini have their hand up who wanted to respond.
Thank you. I wanted to reflect the question back when we talk about coordination, because there's so many dimensions to this conversation. There's vaccine access, there's vaccine information and education, and there's also the social determinants of health that go underneath that and kind of underpin the whole thing. The question for me is, at what levels do we need coordination, and how are those subsumed within an infrastructure that isn't creating more bureaucracy, so that we are not getting multiple layers of reporting or multiple connections? I mean, one potential solution in community organizing, there's a snowflake model in which we could say there's a hub, but then there's autonomy in different ways, where the community of Mattapan, the community of East Boston, the community of Dorchester, however that works, has an infrastructure that leverages channels that are already working. And so I think it was like Ms. Martinez suggested, if we already know what's working in these communities to get information out, the vaccine is separate. This is just one in a litany of other things that we're going to need to build trust around. It's just the current flavor of the moment that we're trying to work on. And so if we're thinking about it in that perspective, identifying the right community partners, empowering them with information. So it's the network that's within Senator Wilkerson's community that already have access within Roxbury and all of these places, and saying, here's the information you need, here's the reporting structure, here's the I think the centralization comes from what's the bedrock or the touchstone of educational materials, translated, up-to-date statistics, vaccine availability dates, all of those things, so that these places can be their own stewards of that information, because you're tackling trust in that way, and you're also empowering. And I try not to use the word empowering, but you're giving more resources here, because the other component here is, if it's the city is holding purse strings, or the state is holding the purse strings rather. And so then we're necessarily tied to the places where there's money to support these things, but the places that are actually better equipped to be the messengers and to be stewards of the information don't have the resources. So how do you make that connection? But then also think of this as a multidimensional campaign, and scaffold it better. So it's not just access, it's the information, and then also tapping on the infrastructure that already works.
Andrew, Andrew, I saw your hand up.
Yep.
Yep.
fantastic points made by Shalini. And I just want to add on, I think that as the city council, you guys had the power to bring us all together today. And I think that going forward, what we need to do is get everybody into one room to have some of these broader conversations, because it looks to me, based on everything I've heard, obviously I didn't know everything that was going on with the community work. It sounds like people from different hospitals are working on parallel initiatives. If everybody could get into one room, have some sort of retreat or something like that, where you bring everyone together and say, like, let's work on this. Let's figure out where we're working in parallel, where we can augment each other. Because to be honest, we're already working from behind on this. If you look at who's been vaccinated across the state, a lot of people have brought up numbers, but Massachusetts releases the number of people that have been vaccinated in different communities. And it's only 3% for Black people and 3% for our Latinx population. And if you look at that says that we are now talking about just equitable distribution, where we should be talking about actually overcompensating at this point. So we need to have these conversations sooner rather than later. And so we need to, you guys have the power to bring us together. And I would love to see a committee where we all get together and just have these discussions. We're able to split off like Shalini suggested into the snowflake pattern, do community work, do healthcare work, recruit people from these communities into the jobs to distribute and education and give out the vaccines.
And if I might add, that's what I think will also build trust within a government entity as a convener, that people are seeing that their needs are being met as far as housing and jobs and food security and housing security simultaneously with our push for the vaccine.
Thank you so much. Was that the final question for you, Councilor Campbell?
Yeah, I can definitely let the senator go. I do think, yes, we can set up a committee and convene this. My only thing is, at some point, even on the council side, it only goes so far, right? The Health Commission, Chief Martinez, the city, the executive side plays a major role here. And I just don't know that government, frankly, right now is the best to create this coordinated strategy and to bring us all together with a more specific plan, timeline, and strategy, so that we are working in partnership and that everyone is not, there's no duplication of efforts, but that folks who are doing great work in Roxbury, like the Black COVID Coalition, and there are in other communities too, or others, know what each other is doing, but there's a strategy attached, and that we don't feel like we're out on our own. And what I was hearing, it's not just about granting organizations resources, and we should definitely be doing that, but we should also be making more resources available to an awareness campaign and to other organizations that have maybe an operation strategy in certain communities of color, that track record of doing that well, that we should be making resources available for those type of organizations too, to help us.
So, Counselor, and this is to you, Mr. Chairman, as well. The thing that's different here is that because you have different funding sources, you have different power sources. And that's really unusual. But so by that, I mean this: there's money coming from the state. There's money coming from the hospitals. The hospitals, right at the beginning, in June, when the announcement was made about vaccines, we actually went to Brigham and Women, and then Fenway Community Health Center, who partnered with AstraZeneca, they came to us. So we're meeting with them separately. Then we get a call from Beth Israel. They are connected with Johnson & Johnson. And I think BMC is with Pfizer, right? And so you got to have a conversation with each of those hospitals. And then the Commonwealth has their funding source, and they are putting it out there in different ways. So you got to run. And then the city has a funding source. But I think the power source is in government, because at any time that you all call people together, they have to come. They may not like it, and they may walk slow, but eventually they have to come. And so you have a power to do something that we can't do. And that's the same, my same thought about the governor's totally, he's just out to lunch on this. And I don't know if we're going to be able to change that. I really don't. But we have so much at stake here. Like it doesn't get any more serious than life and death, for real. And so I would really, really, really implore you to flex that muscle. We've been working with Council Mejia. We've been working with you on different aspects of this around just the response. I mean, I tell people about the experience that we had over the whole summer when people were bucking the you know, no big gathering compliance and the masking, and you saw what happened. They had a big party in Cohasset. They had a big party in Chatham. We had a party in Lincoln. And then the kids came back over Labor Day at BC, and they had like an emergency public health meeting. The state of Massachusetts called the mayor of Newton and the mayor of Boston and the public health commissions from both towns, both cities, and brought the state Department of Public Health and had a meeting because 17 students got caught at a party over Labor Day. We had 4,000 people on Talbot Avenue the week before, and the governor calls the state police. Cohasset, they sent their public health folks. Chatham, they sent the public health folks. Boston Harbor, remember the big boat cruise? They talked about a fine, but they met with them. They ended up talking with people who were there about public health. For Dorchester, for the Black and Latino communities that were celebrating that week, they sent the state police. That's always been my issue. And the governor's response, when the press said communities of color are a little concerned because they seem like you didn't treat them differently, he said, given the tension nationally in these communities, he said you would think that what we did was exactly what you would have wanted. That's what he responded to a reporter. What we did is exactly what you would have wanted. So when he says right now that they're going to they're opening up we're going to phase 3 because we're doing testing and the numbers are down. Yeah, except for Black and Latino people. Everything is except for Black and Latino people. And when they do that, understand what happens. The people who have to get called into service to accommodate the increase to 40%, right? In the gyms, it's all us. So our folks have that's their job, and they got to go because they need income. They don't have any choice but to say, I got to go to work. So we're the ones who then get put in bigger danger every time they do that, which is why we've never been able to get lower than twice the city's average. So when they say that right now, Roxbury, 02119, 02121 in Grove Hall, they're at 10.1%. We're at 9.8%. A month ago this time, we were at 14.7%. And the city says, if we get to 5%, we close the schools. They closed the schools at 5%, and we're almost 3 times that number. And there's been no, like the flag, the red alarms, like all alert. Mm-hmm. Never happened. It hasn't happened once for our communities. That's why our job is so tough.
Thank you so much for that.
Thank you, Senator. Thank you, guys.
Councilor Mejia, I want to make sure you have a chance to come in and ask questions.
Oh, absolutely. Thank you, Councilor Arroyo and Councilor Campbell. Can you hear me okay?
Yes, you're clear.
Yeah, wait until you get to one of my committees that I'm going to chair. You'll see what I'm going to pay back. Now, I'm just joking. So real quick, this is what I said in the beginning, is that what lessons have we learned from the first rollout? Because what I have seen in my time in City Hall in the last 10 months is that we are coordination poor, but resource rich. And we're not really, we spend a lot of our time pointing fingers about who's supposed to be doing what, when, why, where. And we're not centering, as Josiane and Senator Wilkinson pointed out, is that we're not centering this conversation and leading with the people who are out in these streets doing the work, right? So I do see us in our role in government as uniquely well positioned to be leading and convening and holding ourselves accountable to that. And I think that is where the opportunity lies, and how we go about this moment in time and how we can right the wrongs from the last go round, right? So I think that I love Councilor Campbell's question in terms of what we can do, because you all are the experts, you're living the realities, you're doing the work. We should be developing our RFPs alongside you all, right? Because you know exactly what is needed. And I don't think that that's how
the city functions. And I think that this is where the opportunity for growth exists. So I really do appreciate all of the amazing ideas that came out, especially Andrew. Like, I love the idea of having a retreat, right? There needs to be all hands on deck, everyone, even if it's virtually, but like unpacking this from a best practice. What can we do moving forward? So really do appreciate that. One thing that I'd like to ask Josiang, in particular, and also Senator Wilkinson, if you could just elaborate on this. You know, I love the fact that you talk about translation and interpretation, and that's just one part of it. But, you know, I think about a lot of folks who don't know how to read and write, even in their own native language. My mother being one of them that struggles with reading and writing. So I'm just curious in terms of a cultural competency piece, aside from just being able to communicate with literature, what are some of the other things that we can be doing to ensure that these messages are reaching folks who may not know how to read or write?
Question, Councilor Mejia, and you know, this is, you know, something that I have been working for many years on, to make sure that, you know, messages are accessible, not just, you know, in multiple languages. I would say, yeah, I'm pretty sure your mom doesn't miss, you know, TV shows, you know, in Spanish, right? And radio. So those are things that, you know, can still communicate, you know, the message, right? I also think that, you know, the one-on-one and making sure that our folks from the community, the ones that are knocking on the door and trained to talk one-on-one and have these conversations with people that are the ones who are going to convince, you know.
Right back.
So
I'm sorry, I have to answer my door. I'll be right back.
So, I mean, looking at multiple, you know, channels of communication in multiple languages, and also the boots on the ground.
Yeah, thank you for that. And I wanted to, Jaylene, you kind of really talked about the snowflake effect. Can you share with us, and just in your own experience and journey, ways that government has kind of prevented things from moving forward? Like, you know, because I know we tend to be bureaucrats, right? So there's everything, all this red tape. And when we're trying to save lives, like Senator Wilkinson says, literally we're dying out here. Can you point out to some of the bureaucracy and some of the red tape that has existed in government that have prevented folks from really doing the work?
Sure. I have a very recent example, and I would say, well, so when you mentioned the word RFP, that was like a trigger word for me, because that for me already separates out people who are doing the work, and then from those who have the time, the resources, the energy to be able to respond to those RFPs, to draft them, to know the kind of language to use, the ways in which to present a proposal that is acceptable for receiving grants and funding. For me, in early April, I, on my own, started a mutual aid financial redistribution effort. So I myself work at a resource-rich organization. By the way, none of these perspectives are reflective of my employer, but they contextualize a lot of my relationships with community, and wanted to simply enable resource redistribution from people who had uninterrupted income during the pandemic to those who had lost jobs, to those who were in the gig economy, to those who were in the hospitality industry who were furloughed. And it picked up a lot of steam, and it was literally just through social media, through my own outreach to people in my network. And we've since raised $12,000 since April, which is modest, but it's all on my own individual time. And during that time, I was approached by the City Arts Council to apply for a Reimagine Justice or Reimagine Justice grant. And they said, you know, there's money that can be allocated to support perhaps the folks that are reaching out to you for with need for aid that apply to the artist economy, the creative economy, the people who are entrepreneurs, for example. And if you apply to this, perhaps you can, dedicate some of the redistribution funding within your infrastructure to those folks. The ways in which that becomes a hassle is when, if you miss the deadline by a day, you don't get eligible for funding. If it's not aligned with the specific goals or the specific infrastructure requirements or budget allocations and XYZ, whatever specifications there are, then you kind of miss the boat on that. So there is a pace, I think, at which government moves that sometimes is too slow. There's also a level of literacy around government speak and engagement that people need to have, which isn't always requisite for successful community models. I think that there are so many successful examples of community engagement and network development that don't necessarily abide by the ways in which government functions. And so that's one example, and two, I think, pieces there for how I think it becomes more of a hindrance than a benefit.
Thank you for that. And I didn't mean to put you on the spot. I didn't really think that you were going to come with me to with a whole full example of it. I just threw it out there and boom, there we go. I'm so glad that you were able to articulate one so very specific. And I think to Andrew's point, and this is something that I will say while we're here to talk about vaccination and COVID, I'm always looking at where is the opportunity within this space in terms of like how we continue to move forward and what lessons are we learning from this in terms of cultural competency, in terms of communication, in terms of engagement, so that we can build something that is long-term, right? So that whatever infrastructure, whatever blueprint is created as a result of what the genius in this room actually shared, that we can create something that will be used in all aspects of city government for everything that happens, because this is not the first rodeo. We're going to be going through a lot more, and what we learn and how we grow from what we learn is what is going to set the stage in terms of how successful we are for the next go round. And I think that you all here today in the question that Councillor Campbell asked and how eloquently you each talked about what could be done, I think the answer is here. So now the question is, build that committee, create the commission if we have to, put some money behind it and fund it so that it could be sustainable beyond COVID. Because I think when we're dealing with issues that are impacting Black and brown communities, we can't just keep thinking about Band-Aids for bullet wounds, right? We need to be more thoughtful in terms of how we're utilizing these resources, and you all have the experience. So, and I'm looking forward to what the conversation looks like beyond this and really building that infrastructure for real change. And so thank you all. I'm sorry for rambling on as much as I did, but I stayed here this long to be heard. So, I have to be heard. And thank you all for everything that you do, and looking forward to continuing the work, not the conversation, because I'm tired of the conversation. Andrew,
Thank you,
wanted to say something?
Mr. Marshall, do you have anything to say that?
I was only going to say that I wholeheartedly agree, because the disparities that got us into this situation are not going anywhere. And I think this has highlighted those disparities, the health disparities, highlighted our communication issues. And if we can build a structure going forward, then we can actually
haven't been addressed for hundreds of years. So I think that that's a fantastic idea.
Thank you, sir. And thank you, Councilor Mejia. And I actually, before you head off, Dr. Marshall, I know you have a shift change. I think you're one of our last doctors that is actually on here. And I think one of the things that I have wanted to talk about specifically, it's coming up a lot with COVID, but it's something that we need to deal with, period, is cultural competency and addressing racism within our medical institutions and how they treat our constituents, our residents, our folks of color, whether it's microaggressions or in the ways in which they create race neutral policy that isn't actually race neutral. And I know that your organization has done a lot to work on this. And so my question is, one, what are those efforts that you're doing internally or you're trying to get done internally that could use some outside amplification? And what are the ways in which the group of folks here who are deeply invested in that kind of work can pitch in and can help and can start to really push on that fight, because this is going to go further than just COVID. This is how folks in this city receive treatment for the rest of their lives, right? This is making sure that we're in a position where this distrust and these kinds of issues that we have with our medical institutions are being addressed, not just so that they get a vaccine, but so that that's just the way it works from here on out. If you're able to answer on that, Mr. Marshall, I know you do have to, Dr. Marshall, I know you do have to do a shift change, so.
If you don't mind repeating the first part of the question, just because my headphones died in the middle of that, I apologize.
So the first part of the question is, and I'm going to try and summarize it briefly, is
Please.
we've talked a lot about distrust in community with the vaccine, but we know that there's a lot of racial microaggressions, racial disparity at our hospitals, whether it's within the actual doctors themselves in terms of how they're being treated when they're of color, or whether or not it's patients seeking care there, and whether or not it's something about how we do race neutral policies where we don't have actual people of color in those rooms to say this isn't actually race neutral. What are we doing? And by we, I know your organization has done a lot of work on this. What are you doing internally at these institutions to make some changes there? And in what ways can we amplify or help make that happen for those working internally to get that done?
One of the things that I really like about Brigham and Women's Hospital in my department is how committed they have been recently to putting internal money into external facing kind of efforts to address health inequity. You know, whether this is, as was mentioned earlier, partnering with places in the community where people actually go, right? We mentioned Sportsman's Tennis Center, which is in Dorchester, which is where people, like a lot of kids go to learn to play tennis, where a lot of adults go to exercise, and it's a place of like community education. These are places that internally we're putting funding into. In order, like amplifying this message, pointing people to these resources, providing more money to these community centers would also always be really helpful. As far as improving the medical treatment of patients, I think that that's a very complicated issue, right? Because ultimately you want to have more people of color in the position to make medical decisions, right? More people of color like in executive roles, more people of color. I focus heavily on technology, right? One of the things that I think about is how algorithms can bias providers, and we think about like judges, and we think about anybody who uses big data at this point, bias against minorities, right? And if there's nobody in the room saying that, hey, we need to test this, or hey, we need to really look at how this is affecting a certain population of certain socioeconomic status, then we're not going to have those conversations. So I think that it's a really, really hard ask, but we need more funding for pipeline programs, more funding for, educating. I like to focus on mentorship and thinking about educating the young community to position them to be in these positions. And we also need to think of people of color first for getting on these task force, to organizing these events, and getting more opportunities to have their voice heard regarding these disparities, getting their research out there. Because there's a lot of people doing good work, and if the city council does anything, it amplifies these voices, it can go a long way. You're on mute.
Wouldn't be a hearing unless I was on mute one time when I was trying to speak. Thank you so much for that. It's so, I just want to thank everybody really for your thoughtful answers, for really bringing your genuine self here to this. I think a lot of folks came here not to just speak on some points that they wanted to make, but on some very real issues that impact us. And I will just say that for me, a lot of my frustration with this as a counselor is that none of these ideas are hard to find, right? Like these are logical things to do. And it is difficult for me in February 9th of 2021 to not have a transportation plan already for this. We've known we wanted to do this. It's difficult for February 9th, 2021 that we just put in call centers. These are basic things. And I think, there's a question about whether or not, I think another counselor said, you know, cranky or whatever, and glass half full. My glass isn't half full because people are dying. And so for me, the reality here is I know that these ideas exist, and I hope that this amplifies them to the folks who can move it. I will tell you, I think every counselor who's been here, and I'm, you know, I'm speaking for Counselor Campbell, but I'm sure it's true as well, and for Counselor Mejia, these are the kinds of things we're trying to amplify. That was the goal of this hearing, is to make sure that when we're talking about these things, when the media is hearing about these things, they are hearing not just, you know, I bet they're trying their best, but that there's actual plans put in place to deal with things intentionally. And so I thank you for coming here with intentionality and what you presented and what you've said. I will leave it to Counselor Campbell to make a closing statement for the folks that are here. For the attendees, because I see we still have 8 folks over there. If you raise your blue hand, then I will know you have public comment, and I will go to you for public comment. But for closing statements, I'm going to go to Counselor Campbell, then Counselor Mejia, because I see she's here still, if you would like to make a closing statement. But thank you, all of you, for your contributions to this. They've been invaluable. Thank you.
No, I'll be quick, Councilor Arroyo, because just looking at people's time, this was a long hearing. So I appreciate each and every one of you and the work you're doing every day. And, you know, the goal of this hearing is just that, to bring people together who are doing the work every day so we can hear from you where we can do better. And I put myself in the we, right? You know, no ego here to say we could always do better as public servants, right? And so what I heard today, I took a lot of notes, is that one, the city absolutely needs to be granting organizations resources to be able to do this work. And I know Chief Martinez talked about some resources that might come out next week, but I really want to know more about what are the specifics around that grant process. To that point about a complicated RFP, yes, we have designed systems in different ways to allow folks to go through an easier application process, whether it's with the Youth Development Fund or other funds, so they wouldn't have to go through, you know, 20 pages of documents and get the resources quickly to do their work. So we can design that process differently, but also design it so that more folks can apply and that we're being representative. You know, I've just been actually exchanging some messages with folks who represent the AAPI community. I have a large Vietnamese constituency in my district in Dorchester that is having a disproportionate effect as well. How we lift up organizations that are also doing the work in other parts of the city for certain constituencies is really important, but also making sure that they are getting resources to do their work because they have the trusted relationships in some pockets of the city is important. Also, we'll be pushing for more resources on the operations side. You know, we think as a city, we can do everything. We may not have the expertise or human capital, and that's okay. But folks in the community do. And I think, how do we bring them into the fold to help us develop those plans and strategies? So we have a transportation plan. So we have points of contact available to folks. I know folks who are running the Latino Legacy Fund want to resource this. So I'm separately, and I think all of us, connecting these individuals to our chief and to the administration. But I do think that we need a better process that is public. So when folks are aware of this, they can apply for resources to help us be more effective in our response, to set up more sites, to set up more mobile sites, to do better even on testing. I'm always lifting up testing and vaccines because we still have to do more work in communities of color on testing. And then, of course, how do we resource these organizations to also allow them to help us meet other needs of our residents, whether it's housing insecurity, food insecurity, job loss, et cetera. There's so many other needs, eviction issues, and organizations on the ground can help us do that. And I think when we bring this infrastructure that we already have together as a community, because the ecosystem already exists in the city of Boston, that's how blessed we are. But when we bring them together, this infrastructure can be used later on to close inequities that have existed for generations and other inequities we are trying to solve for. So I'm excited to continue the conversation, but also to have some follow-up from this conversation and not to leave it in this space of just a conversation. So I appreciate each and every one of you and the work you do. Stay safe and healthy. And of course, I'll listen to public testimony as well. So thank you all. And thank you for sticking here, frankly, so long. Appreciate you.
Counselor Mejia. Thank you, Counselor Campbell. Counselor Mejia.
Oh, thank you, Central Staff. I'm so sorry. Can I thank Central Staff and thank you, Counselor Roy?
I was going to thank them as well. So they'll get thanks from everyone. But
you know, we have a team. Thank you, everybody. Thank you to our teams.
Dooms don't get put together by us.
Thank you. Sorry, Counselor Mejia. Go ahead.
You are, Councilor Campbell. No, I was just joking.
Gotta thank our people.
Thank you.
Oh, Councilor Mejia, it sounds like you're Councilor Mejia, your audio's off.
You know, call you out if you don't. No, but
Councilor Mejia, your
okay,
audio.
I have the worst internet, number one.
There you go. Are you do you want to try there?
Yes.
There you go. That's
it's Mercury is in right now. Mercury is in retrograde, I guess it's called. So everything that deals with communication is just not working. So I apologize for my bootleg operation here. So I just want to say thank you to Councilor Campbell for convening this, and to you, Councilor Arroyo, and obviously the central staff. But I also, in terms of just kind of really taking it all in, are the
It's hard to hear
community
you.
organizations and really informing our thinking. I do agree that we need to move beyond the conversation, and I think Wilkinson, is it? Oh my God, can you hear me now?
yes.
Can you hear me now?
Yeah, we can hear you
Okay,
now.
so what I was hoping to see, maybe, okay, so sorry, what I'm hoping is that perhaps Senator Wilkinson, Shailene, and some of the other folks that were here today, if we can put together like some actionable outcomes, like things that we can hold ourselves accountable to, right? Like this is we said we were going to do, and put together this working committee to move the work forward, then I really do think that we can walk out of this feeling like there is some movement. So I'm looking forward to taking Councilor Campbell's lead on this, and looking forward to supporting that process, whatever that looks like. But I do think that we are getting to a point where we need to move beyond the dialogue here. And I'm anxious for that, to see that happen. And thank you all.
Thank you, Councilor Mejia. I'll just say I see you have a blue hand, Senator Wilkinson. I'm not sure if you wanted to make a quick closing response to any of that. You're muted.
I had more question to you. I actually would love an opportunity, Councilor, to talk with you, Councilor Campbell and Mejia, about CIC. Now, kind of the behind the scenes and what is going on. I don't want to do it now because I'll belabor it, but you should know. You should know.
And
it is.
I'd be happy to have that conversation.
And we should do it because they're making decisions now. Like they hired a site manager, medical director. The CIC was required to have a hospital partner, and their hospital partner is Brigham and Women. And so, but the weird thing is that their labor and workforce partner is Transformative Healthcare, who happens to own Fallon Ambulance. Those are the people who they had planned was going to be doing the vaccinations. So we met with them and said, no, we have Black doctors, we have Latino doctors, we have Black nurses, we have Latino nurses. We want our folks to come in and see them. And so they also hired DMSE to, yeah, it's crazy, Josiane. That's what they also hired. DMSE Sports was the logistics manager for the operation. And if that sounds familiar to you, DMSE Sports organizes the Boston Marathon. And their rationale was, we know they're good at organizing large groups of people, so we thought they would be good for this. So we just like, no, okay, time out. No. Do you do business with any Black and Latino people? They said, no. Well, okay, that's got to change. And like, so we're literally, we sent them the list of translators today. We sent, we put them in touch with the Urban League because they said, we have our own call center. Really? Where is it? Because I have a feeling your call center doesn't look like the call center that we would put together if we wanted to call people in Via Victoria or in Bromley, right? Like, so the whole thing is a little crazy because they got a big check, multi-million-dollar contract with the state to come in and do us. That's where we need your help, because obviously this is crazy.
So I certainly will reach out to you, and have that conversation. I think if it makes sense to do it jointly with Councilor Campbell and Councilor Mejia, we're happy to
Sounds
do that.
great.
So we'll have that conversation. At this point, I'd like to, and by the way,
Thank you. That's all. That's my
all
only
of you.
comment.
This meeting started, or hearing rather, started 3 hours and 40 minutes ago. So just thank you all for being here. We're running up
It's
against.
important.
We're
What
running
you're
up.
doing is important.
No, real human lives are in the balance, and so I appreciate the work you're doing in the urgency with which you carry it out. As I look at my attendees, and you're all free to go now, by the way, unless you would like to stay to listen to public comment, you are all free to go and enjoy the rest of your day. Thank you. As I look at my attendees, I don't see any blue hands, so I do want to wait a couple minutes, just 1 or 2, to see if anybody pops their hand up and wants to speak. Otherwise, we will be adjourning this hearing. Okay, seeing no hands, this meeting is adjourned. This hearing is adjourned. Thank you.
Thanks, Councilor Arroyo.
Thank you, Councilor Campbell.